scenario is because we do not have that structured organization in our health setups, in IVF industry especially. And most of the time, just one person is carrying out everything related to embryology, andrology, cryobiology, even sometimes counseling and the office work. So this is something which is very important. But at the same time, we are also different in the social structure, because in Western countries, most of the people, they live all alone or maybe very nuclear families. So in our scenario, in our community, we have a support system, or probably we have been having the support system till now, but now we are also venturing into the nuclear societies. So probably those people who were earlier sharing our sorrows or griefs, or who were concerned about our mental status, they are lacking now. So the pressure has started building upon us, and therefore most of the time we ignore our health, and sometimes it becomes a serious health issue. And that's what we are going to learn today in this webinar, where the eminent speakers are addressing this particular thing. Thank you, Vakil.
So I would like you to please introduce our first speaker, ma'am, Ratna ma'am. Can we have the CV, please? Ma'am needs no introduction, but I would like to put up the CV. Sanjay sir, please can you?
Yeah.
So thank you, Nidhi, and Vakil again. It's my privilege to introduce Ratna ma'am. Of course, everyone knows her and she doesn't need a formal introduction, but it's a tradition, so I will have to do this. Ratna ma'am is an MBBS and PhD, and she was and is chief embryologist at the IRM, Kolkata. She has also worked as a research fellow in Cleveland Clinic Foundation, Ohio, USA. Then she's a teacher of teachers. She has been teaching FNB students since 2002. She's also working as a faculty in ART training program at IRM. She's also involved in training program at IRRH since 2003, and many chapters are in her credentials. Many journal publications, and current research interest is idiopathic male infertility and stem cell fusion. So with no further delay, I invite Ratna ma'am to address the webinar.
Thank you, Sanjay, for your kind introduction. Good evening, everybody. I would like to convey my heartfelt, unique opportunity to speak on such an interesting and thoughtful topic today, that is the challenges of teamwork and teaming in IVF lab. We know that to complete one treatment cycle in IVF, 3 major teamworks are needed. One, in the clinic, a team of clinician, sonologist, and pathologist of blood hormone laboratory, a competent team of surgeon cum clinician, anesthetist, OT nurse, OT technician, etc., to recover a good number of high quality oocytes safely. And last of all, in the IVF lab teamwork, who uh, which involves in lot of technical skill and dealing with precious human gametes and embryos. We all know that the IVF lab procedure is a multi-step lab work is a multi-step procedure, starting from the identification of the oocyte, grading of the oocyte, sperm preparation, then insemination, either conventional or by ICSI, then embryo culture, either conventional or by time-lapse imaging, embryo evaluation by conventional morphology or by time-lapse imaging, or nowadays by using artificial intelligence. Then in some cases, embryo biopsy, cryopreservation of the gametes, embryos, and some laboratory using electronic witnessing system for the safety of the patient, for the safety of the lab personnel, etc., which needs a profound background or knowledge about the gamete handling, the genesis of the gamete, the factors affecting the gametes, then different steps of fertilization, then embryogenesis, the factors affecting the embryos, then preservation of the embryos, gametes for future use, etc. And this knowledge is popularly or scientifically known as clinical embryology. And the persons who are involved in the performance of the lab work on the basis of this knowledge are known as clinical embryologists. Now, one clinical embryologist cannot manage all these sophisticated techniques single-handed. So we need a teamwork in the lab. And for effective and successful effort of the lab teamwork, we need a good team formation, which is really challenging. Now, in my presentation, I will try to highlight few points about this through few slides. Yes. The objectives of the present topic. Number one, need of teamwork, history of the IVF team and its responsibilities, IVF lab teamwork, team formation and its challenges, team dysfunction, problem and remedies, then self-analysis or self-criticism and to draw the future line. And last of all, the famous dictum, together is achieving more. Now, we know that safe and effective patient care depends on the teamwork of multidisciplinary healthcare professionals. In reproductive medicine, when we are practicing IVF or ICSI, all the steps in the lab cannot be managed single-handed. Hence, a competent team comprising of skilled, experienced, knowledgeable, responsible, hardworking, and passionate embryologist is needed for the safety, success, and transparency of the lab. Although teamwork has been integrated in health professional education, there is an imbalance with a stronger focus on individual skill development, individual contribution, and accountability. That is a human nature. So now I will discuss about the evolution or the history of clinical embryology. You know, there in the beginning, even during the birth of first test tube baby, there was no clear-cut conception about clinical embryology, clinical embryologist. Clinical embryology was not a recognized medical field or profession until 1918, even 2 years after the birth of first test tube baby. Then few IVF clinics in 1976, one, the Monash, the most famous IVF center in our days, early days, and Bone Hall in Cambridge, Virginia in USA, faced individual but similar challenges with lack of standards to succeed. And we know that Bob Edward, the creator of first test tube baby, was a reproductive physiologist. And he was the first recognized clinical embryologist who sensed the problem and hired scientists to share the workload, referring them as embryologists, which recently is transformed into clinical embryologist. Now, globally, we know that IVF team consisting of clinical embryologists who perform all the technical and sophisticated steps in the laboratory, then andrologists who usually retrieve the male gametes by surgical intervention from the testis epididymis, counselor. We know that IVF procedure involves a lot of money, lot of emotion and failure. So counseling is required at every step by the psychotherapist, anesthetist, clinician for stimulation protocol for ovum pickup, scientists, some center, IVF center, who are interested to run the research activities or who are interested to publish their data in scientific article, they need the scientist. And for the total quality management of the lab, we need quality manager. Now the clinicians does not know the tidbits of cell culture. The scientist does not know how to interact or how to deal with the patient. So, and other staff does not always have the gap between the clinician and the scientist and other staff. They have idea about the culture media, about laminar airflow, about the microscope, etc., etc. And they can handle the patient on everyday basis, or there is some, or when there is some deviation from the normal. So teamwork in IVF lab is an important element for the not only for the lab but also for the whole clinic to mitigate the risk, and diligent work of the embryologist at every step actually helps to run the clinic smoothly and safely, all we know. The introduction of freeze-all cycle, PGT, time-lapse, annotation, vitrification of oocyte, electronic witnessing system, and AI increase the embryologist liability as a team player. So team in the, actually the uniqueness of the teamwork in IVF lab create a lot of challenges, we know. Gamete and embryo care, the creation of new life is a routine work for the embryologist in the lab, which demands continuous straight and strict transparency. Actually, all the steps in the lab are interrelated and all are equally important. A small negligence or lack of concentration of any team member will reflect on the output or will reflect on the result of the cycle. And not only the routine work, the embryologists have to maintain an optimum atmosphere within the lab by monitoring different parameters, by they should have an idea about the function or operation of each. They should maintain the sterility of the lab. Actually, sufficient number of qualified and competent staff in terms of meticulousness and responsibility are needed to complete the clinical laboratory work and supervise or support more junior members. Now, skills warranted in the team member or teamwork are considerable interaction between the clinical embryologist and the patient. You know, it may be on daily basis, or when there is some deviation from the normal, as I have discussed, right, to the number of follicles in the USD sheet, when there is total fertilization failure, when there are only few embryos out of a lot of oocytes retrieved, and regarding the timing of transfer, regarding the number of embryo to be transferred, they have to interact with the patient. And we know that procedure for ERT depends on the skill of the
Ma'am, please unmute. Please unmute yourself.
Ma'am, you went on mute. You have done.
Ma'am, it is on bottom left side.
Ma'am, bottom left side, ma'am. When you scroll your mouse, you will see the mic logo. Yes, ma'am. It's okay, ma'am. You can speak.
Yeah. Sorry.
No
Sorry
problem.
for the disturbance.
No problem.
Yes, I think. And and
And you were on seventh slide, seventh number.
the embryologists have to do some administrative work also, not only. Okay. No. Actually, yeah. A teamwork. Actually, the definition of teamwork, it is a collective work done by few individuals for a lengthy procedure of different nature. And similarly, the lab work in IVF. To their success, the team members should prioritize the patient care, patient benefit, and keep aside the difference in pity and sincerity, create challenges to reach the goal. But an encouraging, supportive, and protective act.
I think ma'am has dropped out of the call because of network issue. Yeah.
Let's wait for.
Yeah, we'll wait for a few minutes. Yeah. You can give her a call if. So there is a slight delay for the audience. So we'll write back. Yeah.
Vakil sir, you can share a few words of experience from your end till ma'am joins us regarding the embryologist health. What is your say, sir?
So regarding to stress or regarding to the journey which we have all come through, because I think we are the last generation of the embryologists who were trained on site. I think actually nowadays we have now the next generation is coming directly from the colleges and universities who are getting trained, formally educated in the universities. I think we were the last generation, I think, which came, learned their way out during the practice and learned from the seniors. And I think, which I used to tell, and you may agree with or disagree with me, I think it was same like getting how you get your PhD guide, like it's on your luck. So it depends how lucky you are, how good your senior is, because your whole career was depending on that one person. And somehow that was one thing which we were stressful. And other thing was like, for the young embryologist also, I would always suggest that the field, you have to be patient and give it some time. So I think ma'am is back online. Yep.
So the best part is that today in our webinar, we have from the senior most to the junior most here
Yes.
in our team, giving all their views and experiences and sharing the platform together. That is something to look forward to, sir.
Yes, and I think it is really nice because I was just getting texts from the students from the university, like they are very excited to learn about the same. So welcome back, ma'am. So we can restart.
Sorry for interruption.
No problem.
Actually, this is another kind of stress. And
Yes, ma'am.
so an encouraging, supportive and protective attitude from the senior towards the junior, and a respectful, transparent behavior.
Ma'am, you can just read the slides even without sharing the screen. It won't be a problem.
Yeah, we are trying to get shortly.
No problem. No problem. In a moment, sir. Let me just make you the co-host again. So now you can, Dr. Ratna, please tell your team now they can try. Can they able to share? Yeah, now it's working. Yeah. Yes, it's visible now. Yeah.
So now, and transparent, respectful behavior from the junior towards the senior can create a healthy working environment for the teamwork. Moreover, sharing of stress, agony and problems with fellow members will create a better and comfortable workplace. They can reduce their stress, they can reduce their, they can open up their feelings so they can work more freely. Individual success should be considered as the success of the whole team. Similarly, failure of in any step by the junior should be looked as a failure of the whole team. But if there is any negligence, we have to locate, we have to analyze, or any lack of concentration, then we have to analyze and we have to warn the team member not to repeat it in future. That is the responsibility of the senior. Now, knowledge sharing by regular journal club with newly published relevant article and sharing of experience after returning from the conference. It is not possible for all the members to attend the conference. Is required to update the members. Continuous supervision and training of the junior members help to improve the perfection of the teamwork. So well communication with mutual trust and respect about the fellow mate is the backbone of teamwork. Now, but frequent self-analysis and evaluation of performance is needed for upgradation for every member. Now, the team formation, that is really challenging. To form an ideal team is nearly impossible, we know, but some kind of compromise, sacrifice, or generosity without prioritizing self-ego can help to form a good team. Understanding the requirement or need of bonding between teammates in handling huge workload or to fight against the odd situation and in dealing with human gametes and new lives may improve the mindset. Huge documentation, especially nowadays about the new ART bill, we have to fill up a lot of paper. We have to do a lot of paperwork. And moreover, to maintain the KPI, we have to do a lot of documentation. So it also needs the transparency and honesty of each team member. And they should learn it from their seniors. Difference in skill or knowledge is less important as per my experience than similar mindset. Like wavelength is more important in choosing the teammates. So frequently we need self-analysis, self-criticism. Moreover, we need data tracking, data analysis for the KPI. And we do the monthly case evaluation or case study, not only for the failure cases, but also the cases from which we achieved success, just to know some new information, new idea, so that we can modify, we can proceed accordingly. And weekly meeting among the IVF lab teammate about individual performance to reach the aspirational goal, to reach the benchmark is needed. Now, teaming, that means it is a famous dictum that together reach achieving more. A successful IVF clinic depends on a high-functioning laboratory comprised of a talented team of embryologists dedicated to providing patient-centered care. IVF teams thrive in a culture of safety and transparency, where all teams embrace a mindset of continuous improvement. As individual, we can only take the field forward so far. However, within and among our infertility spaces, we can partner more effectively and fully realize the vision of together, each achieving more. So, in conclusion, or the take-home message should be respect and support from colleagues with shared goal will make the team strong and improve laboratory work environment. Conversely, blame and fear of error may end up in a toxic workplace that we have to tackle sincerely, carefully. Self-analysis, criticism is needed to avoid or to repeat the mistake. Practice, training, and knowledge sharing are the basis for perfection and upgradation. And to follow the ethics and lab protocol will form a foundation for the safety and smooth running of the laboratory. So there is a famous quote. It was just very favorite of our beloved and respected sir. The dwarfs on the shoulders of giant see further than the giant themselves. So we have to take care. We have to consider each junior most member as essential part of the team. So they may be the future pathfinder of the team. Thank you.
Thank you.
So,
Sanjay.
yeah.
Dr. Sanjay.
Yes, sir.
Yes, lecture is free.
Sorry. So I thank Dr. Ratna ma'am.
The disturbance, sorry for the disturbance.
No worries, ma'am. These are the
No worries.
technical glitches that we often encounter during these webinars and all those things. And it is beyond your control. So no
Yeah,
problems.
that's true.
Yeah. But the thing is that you have very beautifully summarized how the team should be and how every element of the team is important to perform better than the others when they work in tandem. So thank you once again. Any questions do we have, Vakil, from the audience?
So we have one question in the Q&A, and I think it's really interesting. So the question is by Yukta Solanki, that how do we deliver negative results to the patients?
Yeah, it's very important. Very,
Yes.
very pertinent
It's very-
question.
There are a
Yeah.
lot of reasons behind it. It is not only the fault of the embryologist. They are not the magician. They are not the god. There are so many inherent defects of their gametes, of the environment, and of the endometrial receptivity. So we are not the sole person to, but we should be sympathetic and we should evaluate the reasons behind the failure. That's true.
And in fact, Yukta, you know, this is an art of telling the negative results, how to break the negative news. And if you go through the literature, you will find very interesting articles about this, because there are not just in IVF, but there are certain areas where breaking negative news is very important. And already stressed out patients and patients who are like dealing with critical illnesses. So these things are very important, and that's why here comes the importance of counselor. So if you have an in-house counselor, or if you can call in a counselor who is a professional person who knows how to deal with the situation. So not just the embryologist, but also other parts of or other members of the team of IVF can learn from those professionals. And then, because not just the embryologist, not just the clinician or the counselor, even the patients, they do talk to the lower staff, to the nurses. So everyone should know how to talk, how to deal with these situations. So thank you once again, Ratna ma'am. It is always a pleasure to listen to you.
Thank you. Thank you.
After this wonderful lecture, now we have with us Dr. Rajvi Mehta. She has worked in the field of ART for over 3 decades and invited speaker for many conferences like IFFS and ASHRAE. She's also an executive committee member of ACE, and she's in charge of IFS, SIG and holistic
Sorry, Nancy.
medicine.
Sorry to interrupt you. Dr. Rajvi, joint treasurer of ACE.
Oh, it's the CV is not updated, sir.
Yeah.
Then. So currently, Madam is working as an academic consultant to Cooper Surgical and scientific consultant to Trivector Biomedics. I welcome you, ma'am. Please come and share your views with us.
Thank you. And firstly, I would like to thank Ahira for inviting me, and more so for selecting such a unique topic. She just mentioned I spoke at ASHRAE, and it was way back in 2015 that I was invited at ASHRAE to speak on yoga for in the field of infertility and IVF. So it's nice that Ahira has taken this initiative. I think this is, when the field was small, there were few people working. It wasn't so demanding on the embryologist. Now there are various factors that come in. And I think in the very recent past, the loss of our fellow colleagues, unexpected loss, has alerted the entire fraternity that we need to look beyond our work to our own selves, because if we are not healthy, how are we going to deliver good work? And whatever our motive for coming into the field of embryology, be it making good money, be it serving mankind, be it the challenges involved, whatever reason we come into this field, if we are not healthy, then there's not much we can do about it. So I really appreciate this entire webinar on this topic, and I'm going to be speaking on a subject which is not often spoken about on the field of yoga. But before getting that, why do we get into it as embryologists? And Sanjay did start talking about the surveys done, and here I'm going to be talking only about this survey, which was quite an elaborate and done by the Spanish community on their embryologists way back in 2014. And what that survey showed was about the health of the embryologist. And if we look at the kind of health issues that these embryologists face, what we found that nearly 42% often or sometimes had headaches. And mind you, getting headaches is indicative of various factors, physiological, but often could be due to some kind of strain in the spine, back, and neck. Then, if you look at the problems of neck pain, nearly 70% had some experience with neck pain. And I'm sure everybody in this field who's been there for more than 2 to 3 years would have experienced some form of neck pain. Most often we ignore it. Most often we sort of, unless it becomes chronic, we don't really bother about it. But 70% is a high percentage of people even to experience neck pain. And we do see this now more frequently with the post-pandemic, with other workplaces also. Backache, if you look at it, even here, it is nearly more than 58 plus 78, 76% complained of backache. Now, all this indicates that, yes, we are not a very healthy fraternity. And yes, it may not be different from the other populations, other workforces. I've done a lot of literature survey on other health professionals. And yes, there are specific health issues coming with specific specialties in medicine. Then if we look further onto the other aspects, pain in the arms. Now you can see 70, 85, 95% of the people always or often have some pain in the arms. This is not normal. And it can be attributed mainly because the kind of work we do, or we are sitting crouched up in front of the microscope. Pain in the legs was not experienced, a very small proportion, so could be their own physiology. And visual discomfort was experienced by nearly 50%. So again, it could be their own predisposition. But the earlier information that the survey gave about neck pain, back pain, arm pain is something of concern because these are the tools of our body we work with. When one looked at the emotional status in the same survey, it showed lower mental health scores were obtained for women embryologists and embryologists who suffered from headaches or pain in the neck or back, or who suffered vision loss or visual acuity. What it tells us very clearly is that first and foremost, women, because they possibly had other problems, as Sanjay mentioned, the social impact, possibly there are other stressors also add on to the work stress. Also, who found that if they had a physical issue, that is a headache or a neck pain or a backache, it affected their mental health. So it clearly tells us that we may talk of physical and mental health. Physical and mental health go hand in hand. One cannot be there without the other. So if we are having physical pain, we cannot say I'm mentally healthy. And if you are having emotional issues, it reflects on our body. So we cannot segregate the both. And they also shown that there was higher level of emotional exhaustion or cynicism or lower levels of professional efficacy. And so our physical health may lead to the decrease in the team spirit that we were referring to earlier. So although this study has been done in Spain, I don't think there is any difference with the embryologists in India or in Spain or any part of the world. The human body is the same. There may be slight variations in the social behavioral pattern, but the way we work does not change. Now, having said that the body and the mind, emotions and the body are strongly connected, here if we look at it, is this because of our posture? And however best ergonomic chairs we may have, ergonomic stools you may have, whatever we do, we have to lean over. Which embryologist can lean back on a well comfortable chair and work? We need to lean forward when we work. Our head generally goes much forward while we are looking. And you can see the position of the posture of the neck, where you can clearly see the behavior of the neck here, where it is leaning forward in all these conditions. And these leads to the shortening of the neck at the back of the neck, which in turn is bound to give you some kind of a pain. So one can say that, it is our posture. Secondly, you're working with the XC machine constantly in a very restricted space, which is going to. Now, add on to this, this is one of the major causes, I would say, of the discomfort that a profession gives. And it is nothing new. We know about it. I'm just highlighting the fact that it is objectively assessed and subjectively experienced by us. And by showing these pictures, I'm showing how we shorten the neck while working. And add on a stress, which is very unique to the embryologist, is the pressure that is always there. If you have very few eggs, then there's a pressure that you're going to have to create them, convert them into embryos, because if we don't convert them into the embryos, it's not going to work. If you have many oocytes and you have few embryos, again, that's a question. Something is wrong in the lab, whatever the cause, so that's a stress. And if you have many oocytes and many embryos, of course, there's this decision to be taken till AI comes in, until we are fully confident of AI. So we have our stressors, physical stressors, physiological stressors, and mental stressors, apart from whatever we may experience as human beings themselves. So how do we prevent or reverse this? Decrease working hours, and which is not going to be possible as the demands increase. Of course, a whole new workforce or embryologist is going to come in with the training master's program, but will they be totally independent? No. So as Sanjay said right at the start, that in our condition, there are one embryologist who's working in multiple centers. So decreasing working hours is not going to be something which anybody would want to. Have more embryologists, decrease traveling, because when people are traveling from one place to the other, that adds on to the stressors, and then just take it as an occupational hazard. And here I would say that if we say it as an occupational hazard, I don't think we should just accept it and go ahead. And it's here I would like to quote my guru, who said, yoga cures what need not be endured and endure what cannot be cured. And I think a lot of our physical stressors, which we experience, also our ability to handle stress, can be reduced by the practice of yoga. And by doing that, we will not so by doing this practice, we will be in a position where we will not be dependent. We can, not just take it as an occupational hazard and accept it and live with it, but we can be in a condition where
and the screen is not visible.
Yeah, I just saw that.
The deck is not.
Yeah. 1 minute.
You can reshare it.
Yeah, I'll just open it. Share. So we need not really endure these kind of aches and pains to whatever extent we can. So now we are all basically, I would say, scientists to start with, and we want to know, we hear so much, there is so much out in the world saying that this can cure this, this can cure this. I'm just presenting just a very few slides on the evidence that yoga works in this kind of physical discomfort, and obviously along with it, the mental issues or emotional issues that we face. So this is a study published in Pain, which is a very highly rated journal, I would say, an Human Reproduction RBM online level. And this, they showed people with chronic low back pain for over 11 years. And within a span of 3 months of practice, there was a 64% reduction in pain, 77% reduction in functional disability, and 88% reduction in pain medication. And today, for low back pain, yoga becomes the primary mode of treatment. Secondly, when we look at neck pain, which is of great concern to us, because even if we are not getting it all the time, it is not chronic neck pain. Sometimes we are getting it that occasional, and sometimes will become more often. From more often, it will become chronic. So it's time we address it before it becomes chronic, because anything addressed at an earlier stage is definitely going to make it easier to handle and overcome than in the later years. So year two, in a span of 3 months, and the fact is that they talk about, any form of exercise or yoga. So they complain, so pain at rest. And then they found, on the visual analog scale, baseline levels were similar, whether they did yoga, whether they were assigned to the yoga or the pain exercise group. By week 4, you can see the pain level had decreased by, in the practitioners of yoga. And by week 10 of practice, it had come significantly lower in the practitioners of yoga as compared to those who were exercising. And you can see it has gone much, much lower and highly significant. And when one looked at that at motion, because pain at motion is often more, if you're static, the pain may not be so much, but certain activities will aggravate the pain. And even here, you can clearly see that there was not a great difference. The exercise did reduce it to some extent, but there was not as much difference as practiced in the yoga group. And this was also done many years ago. So clearly indicating that yoga works in the cases of low back pain, neck pain, etc. And along with it, the other factors associated with the emotional issues. Now, the question is when we talk of yoga, and one would really say, what exactly is yoga? Because today you ask 10 different people, I think all of them know what yoga is. All of them have heard of yoga. You don't need to introduce yoga. And we do know that it is purely Indian in origin, goes back to nearly 2,500, 3,000 years. And it is known to be something which is good for physical, emotional, mental well-being, and of course, spiritual, which is not something. But what exactly is yoga is very difficult for people to comprehend, because somebody will say it's doing all kinds of postures, somebody will say it is doing Surya Namaskar, somebody will say it is pranayam or breathing exercises. Meditation, often people believe, is an external to yoga. It is an integral part of yoga. Dhyana is an integral part of Ashtanga yoga. So it is also control of the body, mind, and senses. And it gives with it various aspects like the feeling of relaxation, quietness. Sometimes it gives you pain if not done correctly, or sometimes it is just that certain muscles are not worked and they got working. So people have different kind of interpretations of yoga, but the two main aspects of yoga are the asana and the pranayam, which can be taught. The others are experiential aspects. So whether we talk of pratyahar, dharana, dhyana, which is involution of the senses of meditation, are aspects which come with these practices. Of course, this forum is not meant to be teaching what yoga is or things. We go back to why we are doing it. So coming back to the second aspect, moods and emotions, I've just picked up the studies. There are many, many studies, but study done long ago. And we talk about stress. Now, stress is not something unique to our generation or subsequent generation. Stress has always existed, but how we perceive stress has changed. So what may not be stressful for our forefathers may be stressful for us because our ability to handle stress has decreased. And this is called as perceived stress. And just in the span of 3 months, you can see there is a significant decline in perceived stress in the yoga group as compared to the control group. So having shown this evidence that how yoga works, that yoga works, now our next question is what needs to be done? And obviously, I cannot teach this subject in a span of 5 minutes or 7 minutes, but I'm just going to show you that when you are practicing simple things like sitting on the chair, all the time our posture is such that we are drooping forward, our neck is shortened. By just this simple extending and moving, you can release the neck and the stress. For example, if you are able to take the head lower than the heart, and some of you may be wondering, where am I ever going to do this? It's a beginning. Even if your head doesn't go, whatever with your level of stiffness, whatever you do, if the head is brought lower, it can reduce. And then, of course, the supine asanas, which would help. Now, practically, considering it's a practical subject and coming down to, it's an experience. So I'm now going to take the few minutes to actually demonstrate to you what can be done by an embryologist in their work environment. So first and foremost, as I said, our posture is such, and 1 minute, you can spotlight me. So our posture is such that when we are sitting, we are in this condition. I showed you some photographs. So this is how we are working. So simple thing, first thing that we need to do is whenever you get a chance, take your shoulders back. So from our condition, which is like this, creating stress, take your shoulders back, interlock the fingers. So I will now show you how to. So as you take, don't just straighten the arms, take the shoulders back, interlock the fingers, slightly take the palms away and extend. You can see the elongation in the neck. Don't just pull like this. Second thing is, now if this is my posture, I can hold the wrist. So I hold the wrist here, take the elbow back. So if you see from the side, where is my elbow? I take the elbow back and then extend my arm. Now you can see the region of the dorsal, because back pain was highly seen in that survey. So also neck pain. So if I am like this, my neck is shortened, my head is forward, it can give me like that classical cartoon that has been doing the rounds, how men evolved from apes and now back to our computers, how we are changing our posture. So take the shoulder back, extend it, you can release the neck to a great extent. Similarly, you do it with the other hand and you release the neck. So that's third. Third thing is, now not everybody has neck pain. There are youngsters here who have just started into the profession. They would want to prevent it, or they may even feel, is there a need for all this? Well, having been in this year since the 1980s, I can surely say that as time goes by, you are going to age, your workload is going to age, the body is going to take a toll. So you have to do preventively, not to, say, so in that case, what can you do? So for those who are young, who are flexible, what you can do is roll the shoulders back, like we greet people with a namaskar, take your hands back. So do a proper namaskar at the region of the chest or the back of the chest and then take the elbows. Now this gives tremendous release to the neck. Now this is for those who are flexible or young, but for the others, it doesn't mean that you give it away for a next lifetime. You can start with this action, then you go to the elbows, extend and release it. Then you can start with moving it lower, then higher, and then take it back. So all this gives great relief to the neck. Now I showed the classical picture of how to take the head. Now, for example, if somebody is stiff, they'll say, I can't even bend so much. What do you expect me to take the head down? I will show you. You just spread your legs further. Use your hand on the back of the skull. So extend the back of the skull and extend the head down. So this is the condition which is, as you can see, there is shortening and tension. You can hold the back of the skull with your hands, extend it down. The more you extend, it brings relief not only to the neck area, but also to the eyes. And sometimes, if this is also not possible, I would say we all have chairs at our workplace. If you have a chair or a table, just entwine your arms, place them on the backrest of the chair or the table, rest your head and let that neck get relieved. So also the brain. So this is something, you have a table, just rest there, not your workstation, please, but any other table and just rest. You need to do this to experience this. Now, I will just bring two more aspects to this. Vakil, I have time because I can go on.
Yes, ma'am, please.
Okay. Now, another thing, so I've just shown you simple movements. Now, I would also show you we all have tables and chairs at our workplace. So there's no question about that. You just sit sideways. Take an immobile chair, not the ones with the wheels, or lock it up. Sit straight. The moment you sit straight, because this is our condition and worst is in the microscope, sit straight, hold the backrest, and then you can turn. So the more you turn, you release the spine and the neck. So if you want to see it from the front, from the movement, so I sit, now this is position, become tall, you can hold the seat and turn further. This appears a physical action, but it is actually affecting both the body and the mind. Now, last two things, the body, mind is connected to the breath. So when we are anxious, our breath becomes short. We hear the English expression, butterflies in the stomach. So when the breath becomes short, we become anxious. And anxiety is something which an embryologist should never experience, because if we become anxious, then we are sure to make mistakes. So in this case, there are ways and means to quieten and soften the breath so that anxiety comes down. Now, how do we do it? I'm going to show you some very simple tips. First, when we are tense, our forehead lifts. So you can place your hand on the forehead, gently extend the skin of the forehead down. So tension releases. Then you can take your palms, place them very gently on the eyes. Be sure that you're not pressing the eyes, because all of us do strain our eyes. Our eyes are nearly bulging out. Gently and extend the upper eyelid down. Interestingly, When we press, extend the forehead skin down, neck also releases because it is the same skin which connects the neck to the skull to the forehead. So the more you extend the forehead skin, but one has to have sensitivity of how much to press. If you press too much, you're going to create tension. Just pulling, the skin is like the biggest sensory organ, extended down, eyes also relax. Breath slows down. Sometimes we can just take a few minutes to take the time off. Just let your eyes go back, relax, let the eyes go as if they are being attracted towards the back of the skull, and silently observe the breath. Just by observation, the breath slows down. So we cannot quieten the mind. You cannot say the mind is tense, mind don't get tense, mind don't get angry, mind doesn't listen. So if somebody is not angry and you tell that person, don't get angry, the person is going to get more irritated. So we need to learn these ways and means. And in this limited time, I've possibly short my time. I've just introduced the subject, but these 3-4 things, if we incorporate, because we do have that much 5 minutes, and various times, we can easily do it. And if we do, at least we can keep chronic common issues a little far away. We are humans, we are going to get problems, but at least we can keep them for later in life. And to finally end again with the quote of my guru, yoga cures what need not be endured and endure what cannot be cured. So thank you so much, Ahira team. Thanks, Vakil. And
Thank you, ma'am. Thank you so much.
Thank you, Dr. Raju. I think it was a wonderful session, actually. There is so much to learn, and there are so many things happening related to health issues. And I hope people enjoyed this and they will practice in their routine things. So please stay with us, ma'am. We have one roundtable discussion, so we will take all the questions in roundtable discussion.
May I just add one thing?
Yeah, ma'am, please. Go ahead.
Yeah. Rajvi, fantastic lecture. Learned a lot. I have one contraption that we use at Just Look. We have excellent ergonomic chairs. We have invested for all the embryologists in good ergonomic chairs, and we get ergonomic eyepieces that which go onto the stereo microscope and other microscopes, because we have embryologists of different heights. So we have short ones and tall ones. So this ergonomic eyepiece helps a lot in terms of adjusting the eyepiece. It's a very good investment, and I will urge all of you to insist with your IVF clinics to give you the most comfortable ergonomic chairs. Mind you, these are expensive. They vary anywhere from 50,000 to 1 lakh of rupees, but because it saves you all the tension on your spine, on your neck, on your eyes. And please invest in the ergonomic eyepiece. It's not very expensive. It is worth the expense that you will invest in. One more point which I wanted to add, Rajvi, the faster we train our junior embryologists, the faster we will be relieved of our headaches and our backaches, because these young guys have very strong backs. So my suggestion to all you senior embryologists is train all your juniors, so then you can delegate work to them. This is what I have learned over my course of 38 years. And the more knowledge you share, the more you teach, faster you can delegate. Thank you for your time.
Thank you, ma'am. Thank you.
Thank you, ma'am. Now I would like to call Dr. Nancy. Can we have a CV? She is ASRM certified embryologist and working at Jindal IVF and Sant Memorial Nursing Home. And Dr. Nisha Chimote, he is a scientific director and chief embryologist at Vasundhara Fertility Center, Nagpur. And he has he is a member of many committees, and he is a national award winning filmmaker. And I would like to I would like to invite you both and request you to tell their stories. Welcome, Nishat and Nancy.
Right. Thank you, Ruchita. Hi, Nancy. Can you put in your PPT?
Hi.
How was your day? यार मेरी तो पूरी पीठ दर्द हो रही है यार. Shit. I mean, like, I did see Rajvi ma'am's yoga and I felt a bit better, but then, sometimes you need to have things
So-
like these.
It's like
Massages.
story of every embryologist.
Exactly.
Always
I mean, we
exhausted.
all go through it. The back pain and the neck pains. I mean, that is really crazy. What we have to go through, and over a period of so many years, like how Firoza ma'am just mentioned about those ergonomic chairs and the eyepieces. I believe that we should now. It is the time that we should invest, because more than anything else, our health is the most important, whether it's physical or mental. So let's begin with our stories.
Right.
Yeah.
So you know what, I've been also hearing a lot of complaints from many embryologists. When we talk, they are always like, there is always something going on. Either physically where someone is not well, either mentally, there's always something is up. So I'm very glad that iHera and Cooper Surgical, they have taken the initiative of sharing the experiences of people, and these experiences will eventually help others to overcome their problems. Like what we hear from Dr. Rajvi, it's definitely going to help a lot of people in a different ways and different manners. What do you think?
Yeah, absolutely. I mean, that is the need of the hour.
Just a minute. Nancy, can you just change the slides, the background?
Sorry?
Stop sharing the screen.
We can still see the CVs. Can you share your?
You need to put the PPT, our PPT for the.
Oh, it's not there.
No, it's not there.
Just
CV
wait a
is
second.
visible.
Is it now?
Let's say
No,
not
it is
yet.
not.
Just give
Reshare it.
Nancy, this is example of anxiety.
Yeah, no, sir, I'm not anxious. It's example of multitasking. I'm handling the series also, and I'm also handling this PPT here.
Yes, that
Because
is why the exam.
both
And
my
that is-
coordinators are like very busy. They
That's
have
what
to-
happened
That
in
is
the
why,
lab.
Nancy,
Oh,
that is why we need
see,
more embryologists in the lab.
Guru
Yes.
of Gurus is here. Welcome, Swami sir.
Namaste.
Namaste, namaste.
Sir,
is- I think now it is going to be here. The series. Sorry, the PPT.
Yeah, now it's starting.
now?
It's starting.
yeah,
Yeah.
lovely. Yeah. Just
Yes,
in
it is.
Yeah,
right, Shubhra.
you can start with sharing.
Yeah. Right. So, Nancy, so how was, like you said, how was your day? I mean, it is too much of stress, too much of work. We go out, we go for weekends. Generally, our weekends go like this, or they go in the conference. So, or they go into your egg pickups or transfers. So, where is the holiday? Where is the vacation? Where is the relaxation? And I believe that is where everything goes wrong with us. It's okay in the first 3-4 years where you're like complete, in your spirit and already with all the garam khun to go and practice every day, make babies and give pregnancies. But with time, I think as you go get to 7, 8, 10 years, 15 years, 20 years, things change because it's such a monotonous job at the end of the day. It's a repetitive job. And this also affects us in so many ways. So yeah, Nancy, take it away. I think you've got the next part of it.
Why do you think it's a monotonous job? It's not.
Well-
We learn new things every day. We have
Yeah.
something new in our laboratory every day. It's been 10 years, and still I feel like yesterday I've joined and there's always something up, something is coming, and everything is
Yeah,
like that. I think everyone
monotony.
feels like that. So
Agreed. The monotony is towards the repetitive thing of, shifting of the gametes, moving the dishes, doing the ICSI, you've got the same things again and again. So that is the monotony in the repetitiveness. Yes. When it comes to the subject and what new things are coming, I mean, embryology is the subject, no doubt
Yes.
about that. But then it is affecting us because we are doing a lot, 8 hours, 10 hours, 12 hours, and every day. So it does take a toll. So there is where we are headed. And somewhere we also go towards burnout. Like I will say that I had one 3-4 years ago, for 6-8 months, I was totally okay, why am I doing this? I've been doing this for more than 20 years now, and now what have I achieved? There is some existential crisis. There is some you become very sad about certain things. There is a total burnout condition that you don't want to feel like doing it again because you've been doing it for so many years. So how do you fight it? And I would like people to come up and discuss their stories. I believe we'll be doing it in the later part of this. Initially, I think we'll be discussing the stories. So
Yeah.
let's begin with the stories.
Let's see what we have, what experiences we are having today. So for the first one, 7 years ago, I began my journey in the field of embryology. However, just 1 year in, life took an unforeseen turn with a diagnosis of carpal tunnel syndrome. The news was quite a shock, and I found myself questioning the doctor's assessment, given that I was not immersed in computer intensive activities. Their insight attributing my lab work involving pipettes and as a potential factor. As an embryologist, our days are filled with endless pipetting and hours in front of microscopes and computers. The toll on my hands and eyes were relentless. It was a wake-up call. I rearranged my workspace, took regular breaks, and did hand exercises. Today, I continue my research stronger and more conscious of the importance of self-care. So it's really encouraging, and I just realized that this is so true. Every embryologist, we are so much indulged in pipette, so much of vigorous pipetting, and so much in front of microscopes every time. So it somehow it affects our hand movement. So it's very important to take breaks in between. So what do you think? What else could be done?
Yeah, I mean, like I can see a lot of messages. I mean, it ends on a lighter note, on a happy note. But I see a lot of dark stories inside. It's like the person here was immersed into computer intensive tasks. Probably not interested in that. And embryology is more towards, earlier it was thought to be just lab work and everything. But now today we have to do a lot of data logging, data analysis. Everything goes hand in hand. And it is very difficult in today if you're just one or two people in the lab to do all these work. You have to prepare the lab, you have to do all the microscopy, you have to do the processes, and then you have to log the data, make sure everything is proper, analyze the data. There's so many things that you have to do. And here I can see that pipetting, yes, you do have problems with your wrist, you do have problems with your thumb. I have lost senses in my thumb for so many years now. So that carpal tunnel syndrome is there. That is one unfortunate physical attribute that can come up with many people. I think Rajvi ma'am also discussed about it. So these things are there. The neck problems are there. Eyesight. How is your eyes? I mean, luckily abhi tak mujhe to chashma nahi laga hai, but my eyes tear up. I mean, they come out like aise bahar aa jate kai baar.
My eyes are also suffering. Like I've got specs, but I hardly wear them. That's not a good sign, but I do. So I agree that there are a lot of problems which come up during our processes. But as Madam mentioned, that Dr. Firoza mentioned that we should go with a more ergonomic setups to avoid these problems. And I also want to ask you something. If you've lost senses, and when was the first time you discovered that there is some problem with the?
So it started very slowly. First of all, my thumb started, like vibrating a lot at this end. I could put, this is very stable. This is not stable. This moves. So it started slowly, steadily. It never stopped. And you're continuously pipetting every day, 365 days for years and years and years. All your nerve endings get affected here. So, and that's how it is. So giving it a rest is the only way. Getting medical treatment is the only way. But luckily, it doesn't affect you that much. So it's good otherwise.
And it's also important to take signs from the body. Whenever this started first, you should have like listen to your body. Like this is something.
Right. But sometimes you can't help it. I mean, there are situations where you have to go to 2-3 labs, or your lab is having a lot of work. So you don't have an option. You don't have any replacements or a person who will take your place. And I mean, if you're at that stage where you have to manage everything, so sometimes you have the responsibility, and that responsibility also comes with the giving the results. So there you cannot compromise. So it is Holi, Diwali, Christmas, Dashera, Eid, whatever. You are in the lab. You
No
can't help it.
holidays.
I mean, yeah, so that is the thing. So that also takes a toll. I mean, you must have seen most of the time I'm wearing shades if I go out.
Yeah,
Because
yeah,
of the microscope. I've now like मैं सब बीमारियां आ गई मुझे ऐसा लगता है. I've got photophobia.
I know,
So,
I know how 50% of it. Like
Yes,
50% of problems you
I
have.
have to keep all the curtains closed everywhere. I try that because microscopy itna chalta hai. I mean, initially you hit it with a higher focus. It then changes. Then the light in the room is less, so your eyes need to adjust. I mean, there are so many things. So it does affect you. So physically, yes, embryology does affect you over a period of time. The thing is, you have to be careful. Certain things you need to take care of. Certain things they are not in your control. But then, if you are in your earlier stages of embryology, please try to do only work that is possible. Don't go and do too much of work. Try to divide it, delegate it, and have more people who can help you out.
And there our story ends
Yeah.
with a good and happy note that I continue my research stronger. So,
Yeah, that is I think that is every embryologist. Whatever happens, they are still sticking to their guns. They'll do it.
so I think we have a question in between. Should we take the next story or?
I think Gaurav
Yes,
has
yes.
raised the.
Yes, sir. Yes, sir. You can.
yeah.
You can.
If you are done with the stories, then only I'll go ahead. I have my own story to tell you.
So Gaurav will finish the stories and then we'll have your story.
One and because I was there when everything happened, so that story is very interesting. We have kept that story safe for you. We have already discussed that there is a story that only one person is going to share. The person who has suffered with the circumstances will tell us the story, how this happened and how he overcome everything.
Yeah. So we'll
Can
just
I
finish
do
off
that? Can I play my PP slides? I have 4 or 5 photos to show you.
So Gaurav, what we'll do is we just got 2 more short stories. We'll finish that and then we'll have your story completely.
Because
Okay,
your
no
story is
issue.
very interesting. We'll take it in a long go.
Yeah, in the moderation
No
we got
issue.
your first story set actually.
Yeah.
Okay.
So next.
Yeah. So next story. Okay, so I'll take this one.
Yeah.
All right. So our center. So this is another story by another embryologist here. So that person mentions that our center performs approximately 30 OPUs, 30 ETs, 40 IUIs, and 50 semen analysis, plus freezing, thawing every month, with the team of 4 to 5 IVF consulted, but only 2 embryologists. So see the difference here. Because of multiple consultations, our holidays and Sundays are always compromised. Whose aren't? I mean, very sad. Blame game as a result, very big problem. इतनी मेहनत करो, anxiety रहती है, सब करो, उसके बाद blame दिखाओ. Routine and entire always faults comes to the embryologist, which eventually makes us question our caliber. Absolutely. I mean, after so many years, even I feel sometimes कि मैं गलत कर रहा हूँ कि नहीं. That happens to everybody. I think Ved sir is also smiling here. I mean, even a person of his experience, his ages, can connect with us because this is everybody's stories. Whether you're 5 years, 15 years, 30 years experience, we all have. We start questioning ourselves, and that is a very good thing, but a bad thing also. So all these things sometimes make a question my decision choosing embryology as a profession. So yeah, sad thing to say. Yeah, it is very difficult. Nancy, what do you say about it? What's your take on this?
So I really feel bad. Like somebody has to question their own caliber. Like self-doubt is an enemy in embryology. It is important to assess what you're doing and how you're doing it. It's always important to take advice from the seniors and everyone that what you are doing is good, right or not. It's always good to speak up. But self-doubt, it's an enemy. Like you should not have self-doubt if you're.
I'll tell you very frankly, I get at least 1 call per week from some or the other embryologist. Because am I doing this properly? I have this problem. I'm doubting this. I'm like, kya ho gaya? So the problem is start detailed data logging, take videos, everything, and then calculate and give it. Agar ye karoge, to aapka aadha 90% problem will be solved. So try to do that. And second is at least have 1 more person in the lab. You're doing too much of work. So it's not physically, humanly possible. So one should actually, I mean, it's not practically possible, but then you should talk to your lab people, from your clinician to hospital guys who can help you out with that. So that is the another solution that can be done.
Right. And one thing is, like, if you are giving your 100%, you're doing everything right, and you know there is nothing wrong in what you're doing, you should never self-doubt.
Yeah.
There should be no chance of self-doubting there. And but it's a human nature.
Let's see, the thing is, kabhi मालूम है, बहुत ज़्यादा you are very much stressed, and there is a time when anybody can settle down.
Yeah,
You know,
I get
that is the stage where this person must have mentioned it. Ki after doing all these, also you feel or you fall short,
Yeah,
and it's a very tragic and sad thing to see or say, basically. But it is a reality.
true.
So I think with this we should move into the third story.
Yeah. So the third story is of a junior embryologist. So as a junior embryologist, we were motivated to practice a lot. Yes, we all were. Once I was totally engrossed in practicing with ICSI machine, trying to neck sperms. I was pushing myself too hard that I lost track of time. And suddenly, when I got up from the machine, I had blackout right there in the lab. Luckily, I was just practicing. I realized that even fascinating lab work needs to set its limits. So true. Remember, the pursuit of excellence is important, but so is your health. It's also important. And excellence is not going to come in a day. It will take time. So this needs consistency. The consistency is the key. You have to work. You have to practice every day. You will not achieve anything in only one day. So take breaks for it. What do you want to add to it, Nishad?
One thing I would like to add is that make sure that your team eats well. Or ICSI ke pehle I make it a point, I have some amount of carbohydrates or glucose kind of stuff, that is fast carbohydrates, because kya hai ki your ATP usage is very fast while you're doing ICSI, and then this blackout and that tiredness is immediately felt. So you need to understand that you need to be fed. You should be, your stomach should be full, or at least that glucose level should be proper, so that you're doing all these procedures properly. So I make sure that whenever my team is together, I make sure breakfast kiya hai, lunch kiya hai, nahi pehle chalo khate hai, ya ye kiya hai. That is the very important thing. I make sure that wherever we go, I make sure हाँ इतना ये है, इसके पास मुझे खाना है, इसके बाद मुझे काम करना है, नहीं तो मैं जाऊंगा ही नहीं, because you're working full day. So you need to have proper nutrition, proper amount of carbs in your body, so that you can function properly, and drink a lot of water.
Yeah, hydration.
Very true. Hydration is very important.
Very important, very much. But do you do it like you eat properly whenever you?
Yes, I do. And my clinicians ने मुझे पहले, मैं जहाँ पे भी जाता हूँ, पहले सुबह रहता, आज ब्रेकफास्ट में क्या खाना है, यहाँ से हमारा टॉक शुरू होता है. So that I make, yeah. उसके सिवा हम बात नहीं करते. उसके बाद बताओ कि भाई ICSI semen analysis क्या है, हम बाद में बात करें.
And even I think like with this variety in practice is also like it can also help. Like you can divide your practicing sessions. Like you can work for a few time on ICSI machine and then you can practice something else. Monotony, you can break the monotony and then you can work on something else. And this will also give you a break while performing other practices. Like it will also help.
Right.
I think this will also help.
I think Gaurav Majumdar has mentioned a very nice thing here, that rather than doubting one's own self, one has to doubt the system, and constant auditing is what we need. Exactly. I think I just mentioned it a different way. You're very, it's very true. You're very right about it. Self-doubt creeps in when systems are in non-existent. And that is why I mentioned that data logging, mention everything, take videos, everything, so that you're sure that nothing has gone wrong. Do the QC. Take the temperatures, the CO2 levels, everything, measure everything, so that no parameter is left unturned, no stone is left unturned, and then you can at least have a word, at least forget the clinician, forget with anybody else. At least for yourself, you'll have clarity that I have done a right job. That's more important. So that's one thing. And I think we'll take this second part also about Abhinav's mentioned. What about D3? So one secret, I mean, not a secret, but I do that is every bi-weekly I take D3 liquid because sun mein utna jana hota to nahi hai. Let's accept certain things. We are there since morning to evening. We are not there. So take D3 tablets or D3 syrups, and I think that is good enough. That does help you to maintain your muscular conditions, because yes, you have lots of pains and aches, then that is the reason for it.
I think with this, we'll take other stories in the moderation session.
So I think we'll just finish up and then move to the next, and we'll have Gaurav for that. So just 2 more slides left, so we just finish this off.
So with this, there are like Dr. Rajvi also mentioned, and Dr. Ratna has also mentioned that there were surveys on embryologist health by like there were many surveys on it. Like we have different kind of surveys and everything. Now I'm very glad that IHER has also come up with something like this, where people can easily share their stories, and we can discuss about it. Not till this webinar, even after this, if you want to share your story, if you want to share your experience, you can mail us in here. If we'll try to help you in the best possible manner. It's very important to communicate, because communication is difficult. So communication is difficult.
Yes, it is.
It's not easy for everyone.
Yeah, I know.
So with this, we just want to end it, and it's
Yeah,
okay.
I believe, Nancy, it was a good thing, and I really thank IHERA for one thing, that this is one of the most important topic that we all need to discuss, and we need to come out with it. Don't keep it in your mind and within four walls. Come and talk, guys. All of you, I request you, please discuss with your colleagues, with your friends, and I'll tell you, you have the best friends all in this group itself, because they understand your problem. They have gone through it. Talk to them, discuss them, call them up. Just open your minds, because nothing is more important than your personal, physical, and mental health. So it's okay to be not okay. I mean, that's absolutely fine. And but don't stay there, right, Nancy? I think this is a wonderful slide Nancy has made. I really appreciate this one mostly. That why it is so important. It's okay to be not okay. Just accept it. The moment you accept it, the moment you accept it, you start taking care of the problem.
Yeah. So thank you so much for being patient with that. And we'll be continuing the session in the roundtable discussion after this. So it is always wonderful talking to you, Rishad, and we always learn something whenever I talk to you. I always get something.
Yeah, we have lots more to talk. Always appreciate it.
We are always talking.
Yes.
Thank you, Nishad. Thank you, Nancy, for wonderful stories and you discussed. As said by Nancy, our IHERA team member, Dr. Ananta Lakshmi, had prepared one Google Sheet for survey. You can go on that survey and link on that, and you can share your stories over there. And definitely we trying to help you out. And by doing this survey, we can we can check ourselves, and we can see that how we can proceed in further. Thank you so much. I have messaged in the chat box that Google survey form. You can access from that place, and I will post it in WhatsApp group and all the platforms, social platform. Thank you, and thank you to Ananta for preparing this survey for us. Thank you.
Thank you, sir. Thank you, Dr. Nancy. Thank you, Dr. Nishad, for sharing these stories. These are so relatable to everyone, and you have given wonderful suggestions. You did a very wonderful job. And now I request Dr. Nishad to stay back for our next session. And I request Dr. Jagveer Singh, the clinical embryologist at Cooper Surgical Fertility and Genomic Solution. Can we have the slide of Dr. Jagveer? Nancy? Yeah. He did his embryology fellowship at Institute of Biomedical Research, Chennai, associated with IIT Madras. Has worked in Punjab as an embryologist and consultant for NABH and NABL. He has a life membership of many societies. He has conducted various programs and workshops. He has publications in various national and international journals, has trained more than 100 embryologists, and he is a adjunct faculty of in MSc Clinical Embryology at a lovely professional university. So I hand over to you both, and I request you to introduce our panelists, our experts.
Thank you, Ishita. So,
yeah, please go ahead.
So, Ishad, I will introduce one by one, I think. So, it's my honor to introduce Dr. Firoza R. Parekh. She's MD, PhD, and she's, I think, one of the first pioneers in infertility treatment in India. She's currently working as a director at Fertility Jaslok International Fertility Center. She's also an editor-in-chief and Fertility and Fertility India edition and editorial board member, Fertility and Fertility US. She has delivered more than 15,000 babies till the time she started practicing fertility in India. She has more than 200 publications, 30 book chapters in national international journals, and have 5 award-winning papers. She is recipient of several awards, and I don't know why I'm wasting so much time to introduce her, because everybody knew her. We have heard her in conferences. We have learned from her. She is a legend in Indian fertility practice. So welcome, ma'am. Can we have the next CV? And it's not.
I'm really sorry, something happened. It just.
Right. Okay. So, yeah. So, Dr. Dakshinamurthy Swaminathan, I think he does not require any introduction. We all know him for everything that he does for us. And sir, we welcome you here. Looking forward to your wonderful stories. Can we have the next story, please? Next, okay, CV, please.
Next, we have Dr. Krishna Mantravadi. She is currently working as a scientific director as a Center for Reproductive Medicine, Hyderabad. Again, he also does not need any introduction, but we'll introduce. His master's in clinical embryology from Monash. His PG diploma in reproductive science from Monash itself, and currently he's heading the embryology, and also the embryological department of SS Fertility. So, welcome, Dr. Krishna. Can we have the next slide?
Yeah. So, do we have Keshav here? I didn't see him.
I did. Yes, we have.
Lovely, lovely. So, yeah, Keshav, a very dear friend. I think nobody else requires any introduction. All like big wigs of our field. Yeah. So great to have you here. Obviously, he's the lab director of Rainbow, and come on, it's always fun to have Keshav. Very articulate and always coming out with the best ideas here, always on any kind of events and webinars. So actually, Keshav, looking forward to great stories from you. So can we have the next CV, please? I think we missed one.
So Dr. Rajvi is there. Dr. Ratna is there. We have already introduced them. They're also part of the panel. And
Yes.
then we have with us Dr. Gaurav Kant. He is a dear friend, a senior embryologist at Akansha IVF Center. And he's also co-convener SIG embryology and as co-convener SIG embryology IFS. He is also one of the first embryologist certified for both prestigious international societies, ASRM and ASHRAE, for both senior clinical as well as clinical embryologists, has various publications in international journals and presentations, and well-trained guy and a very nice friend and very good friend. Welcome you, Gaurav.
Right. So can we have, yeah.
No,
And we have,
I think
yes. We have Dr. Anisa, right?
Yes, we have, but her session is post.
Okay.
Yeah.
So shall we begin? Okay, lovely. So yeah, let us begin. I think Gaurav, I believe you're very excited. I'm also excited. So probably you can share your screen, and I would like to start with you and your story and how you overcame it. I'm looking for. We all are looking forward to your story. So please start.
Thank you, Nishad. Thank you. Can you see my screen now?
Yeah.
Yes, Gaurav. Yes, we can see.
So, yes, this is me. So, it is true that embryology has given me a lot. Right? It has given me money, fame, success, whatever I have right now. I'm popular for doing embryology. But embryology has taken a lot from me also. So, there was a time when I used to work from 4 a.m. in the morning till 11 to 12 in the night, where I used to spend around 11 to 12 hours on microscope. And this is what happened to me. I had a cervical spondylosis where I had a C5, C6 displacement in my back. It was very difficult to even sleep in those days. I used to sleep like sitting, putting pillow on my back, and then sit and sleep. You cannot even imagine, out of 24 hours, I used to sleep for 1 hour, 1 hour of sleep for the whole 24 hours. And this has happened for me for 6 months. I used to work like this in the lab, having a belt in my neck to support. I used to have the numbness in my hands. It was very difficult to even do the exercise or perform vitrification. But anyhow, I cannot just go out and say I cannot do my work. I have to be competent at my work also. I used to wear these kind of belts on my back to support me so that I can stand straight. For 6 months, I was on a severe pain. And you know what kind of medications I used to take? Fentanyl patches, morphine isomers, Lyrica. These are the most dangerous drugs. If you take one pill of Lyrica, you feel dizzy. You feel you have 6 packs of vodka. You have these transdermal patches on your back of morphines, isomorphines, where you just feel crazy all the day. You feel like zombie. This has happened for me for 6 bloody months. I had the worst period of my life during those periods. I lost my dad, but I got the beauty of my baby during those periods. I got blessed with the baby girl also, and because of that, I got some motivation to. I wanted to kill myself. I just used to pray to the God that I don't want to live. This is enough for me. I cannot do it more. When I got the blessings, I feel motivated. Yes, I maybe I'm able to help myself more. I have friends like Nancy. She's okay, although she's just supporting me with the belt. It's okay to wear the. You look odd when you go out, right? You're young. You're in your 30s, early 30s, and you go out in a restaurant, coffee shop, and you have belt on your neck. People used to mock and laugh. And people like Nancy support me. It's okay, then you wear a belt. So it doesn't matter. And my face sold like so much because of the drugs I was taking. Finally, after 6 months, I got the opportunity to meet an anesthetist in Gangara, and he injected the drugs in my displaced area to cool down, calm down my nerves. And after that, I have considered it. Embryology is okay, but I'll not push myself too much. And exercise is something which is there for me. I have to do exercise. From then onwards, I have started doing my gymmings, jogging. I'm too consistent on what I'm eating. I'm very particular of what I'm eating. I take some baths. I regularly take my blood test done to be active, and I don't want to see that phase again in my life. Thank you.
That
Thank you,
is
Gaurav.
absolutely stupendous. I mean, what a comeback story. And I can understand it's not only the physical pain that you have to go through. I mean, it's the mental pain of, I mean, the whole story about you having a baby, losing your dad. It is very difficult. I mean, we all have our stories where our life does not stop. That is the problem with embryology. We have to continue our lives. And those people who really, I mean, have the mental strength are the only people who are surviving and doing better in embryology. That's what I'd like to say. So kudos to you, Gaurav. Wonderful story. And I believe people will definitely will be inspired if anything happens in such case that people will be inspired by your story, no doubt. So before we get to, yep. And yes, having friends like Nancy, no doubt. So we are all lucky to have her as our friend, no doubt.
Right.
Always fun. So before we have we go ahead with this conversation, I would request Dr. Gaurav Majumdar to join us, and please also share his story if he has. I would like to know that too.
And would
So
like
we got
welcome. Yeah. So
yeah, we got
sorry,
Gaurav.
Nishant.
Lovely. Yeah. Guys,
Got Gaurav,
can we have
and
your
we have
faces?
Dr. Charu.
Everybody's yeah, would like to see your faces. So if you can just switch on your
Yeah.
camera if possible.
So
So
we
we've
have
got
with us
Krishna
Dr.
Shah.
Dr. Charudar Joshi is also here with us. So
Yeah.
welcome, sir. Yeah. So we request you all
Wonderful.
to switch on your
I already
cameras.
talked to Charu sir in the afternoon that I would like to hear your stories. He's got a lot of stories. I know that. You
So
know,
I would
because
request you
every generation has a different story, because we learn differently, we have different experience, and our experience is very different. So please do that. So I think Krishna was there. Krishna, can you just tell your story about like what was your experience and what did you had like what you had to go through? Any nice story about this?
Well, I'm sure there are quite a lot of stories. Well, I think, we are what we do it. It's we think that we control everything and nothing is like that. And then there are times where we think that we are the only people who can do those things, and we really push ourselves beyond what we can, and that's utter stupidity. And each one of us has experienced that at one point of or the other. So I think I came back to India way back in 2009, and got lost into the ocean of Indian IVF practice. Young blood wanted to run around, achieve the sky, do everything possible to impress my boss and probably show that I could achieve. And 2012, just before my son was born, I was just trying to play around with the glucometer after I checked my dad's blood sugar. And I realized that my blood sugar was 400. I was 29 and 3 years into embryology practice, and I was diabetic. Well, there was a strong family history, but I then realized that I was pushing myself too hard. I wouldn't eat on time. I would not really eat much because I thought that would kind of make me sleepy, not let me work. And then I would come home at 6 o'clock and stuff carbs into me, because that would kind of really relieve my stress. That stupidity doesn't, I'll tell you with experience. 2012, akal ठिकाने पे नहीं आया. Was trying to get a bit of exercise and modification of lifestyle. Then Oasis started getting busy. They started branching out. I didn't know what happened. I just went by the flow. They started opening branch after branch, and I was just there thinking, everything is on my shoulder and I got to do that. And then just last year, September, I turned 40. So it was close to 9 years of being diabetic. And I knew I had a very bad lifestyle because the exercise had come down. I was traveling like hell, I would just come home by 11, 12-ish, land and come home late, eat, sleep again, get up in the morning, 6:37, I'm at the airport. I used to hate being at these airports. And this happened for like 4 years now. And I knew I would have something that would have gone wrong. So I voluntarily got a CT angio done, and the radiologist, who's a very good friend, he said, "This is stupidity, I'm not going to do this." I said, "No, my instinct says there's something wrong, do it." And then he was shocked to see a 90% block in one of the main vessels.
Oh my goodness.
And what he did was he immediately took me to the cardiologist, again, a very good friend of ours. And next day, no symptom, nothing. I was very fortunate. A lot of good wishes from a lot of good people like you all. I just got a stent done. I was kind of back, but it took me 10 years and absolutely screwed up my health completely.
I think this was before the last ACE conference, just a couple of days before.
I, in fact, had a trip planned to Kashmir with family. I said, I'll come to ACE Delhi and from there push off to Kashmir, have a holiday and come back. And the cardiologist was laughing. What holiday? There's a 90% block. First, thank your stars that nothing's gone wrong. My ECG was absolutely normal. Echo was normal. There was absolutely no derangement, everything, but there was a block. He says, I don't know how you are actually all standing here fit and fine. And then they just fix me up. So now I think I'm not saying I have given up my responsibilities, but I think I'm very, very cautious and careful. I think now, yes, taking care of myself is something that's always a priority. But I think I kind of do not want these mistakes to be repeated with my team. So when they are running, rushing, getting stressed, I just sit with them. I make it a point to sit with them and I say, don't think the world will stop. Why are you getting so stressed? And if it means getting an additional person or speaking to the clinicians to say that, you know what, the lab can't handle beyond 4 pickups, you cannot do a pickup at 6 in the morning, or you cannot be doing a transfer at 8 in the night just because you have a conference to go. This is how the lab is going to work. And thanks to the medical director who supports me and says, well, that's probably the way we should be doing it, and we need to draw lines. So for a lot of people hearing me out there, there's nothing more than health. You know, I'm 40, and then sometimes I'm like, I can't really. I'm a foodie. I love eating, and I can't do that. I'm not getting emotional. I'm absolutely happy with it. But you know what? I got with my kids. I just can't be eating whatever I want to eat, and those meds sometimes leave you crazy. If I don't eat at time, my sugar's going low. That's the worst feeling to ever have. You know, not the right thing to do to yourself. Yes, we are in the whole business of creating lives, but let's not give up our lives to do that. I think I'll stop there. There's a long life for all of us.
I found so many take-home messages. First, I have the most important. Next time I'm meeting you, I'm always keeping some candy in my pocket before talking to you.
You know, it's good to kind of have that zeal and passion, but I think you've got to be a little mindful as well. Please do not do the stupidity what I did. So you know, when I see people like going to 5-6 centers and you know morning ये सेंटर गया 4 किया रात तक घूमो फिरो भागो दौड़ो, you're not really going to become Ambani overnight.
Yep.
That's just not possible. So, you know, only, you know, eat how much you can digest. I'll stop there. Thanks, I had that opportunity.
Absolutely. Words of wisdom, Krishna. Really appreciate all your stories and lots of take-home messages I believe people are taking from you. So thank you very much. Now I would like to go towards Charudat sir. एक जल्दी से आप एक अच्छी सी स्टोरी बता दीजिए. आपका क्या एक्सपीरियंस, हम लोगों ने क्या करना चाहिए?
देखो, yes, it is really a good opportunity to express this what you are feeling from inside after listening to Krishna. मुझे लगता है कि मेरी प्रॉब्लम तो बहुत छोटी सी थी. So it all started, my career I started in 93, and उसके बाद at that time you all know that it was a very new field and very less people were there in the field of infertility, where very less number of centers were there. And then after 2000 onward, that boom started coming up. So many centers are there, but a very limited number of embryologists. So I am one of those fortunate people who got that opportunity to go to multiple center, work a lot. And of course, as Krishna says, I'm not an Ambani, but yes, I went to that period when money was coming like anything. Now the whole thing started here. What I want to give message here is, other than health issues, there are various other things which you miss during your work. You enjoy your work, but then at the back of the thing, you are missing so many things. For example, I would like to tell you here, today, whenever we talk about our children's childhood, I hardly remember any story with or time spent with them. And whenever my wife talks to me, and then I am answerless, because yes, it was a time when I should be there, and I was busy with my work, and I never thought of spending time. And believe me, there was a time when I used to be out for work for more than 15 days in a month or 20 days in a month. And when I used to come back to home, my children were used to look me, who is this guy coming in our home? Because they are not in constant touch with me.
Yeah, yeah.
So the very first thing I missed during this entire of my career is the spending a real good time with the family. As far as health is concerned, I also went through so many ups and downs related with health, and of course, I cannot say that it is absolutely because of only workload, but yes, workload was one of the factors. At that time, very limited centers, very limited work, but responsibilities are more because you are the only person working in lab. It was not like today's era, like where we have 4 people working in the lab. It is you only, you have to see the cleaning, you have to see the management, you have to see the case, you have to do the process, and everything means it was done single-handed. So stress was there. Second thing, that's why in few days back in some meeting, I said this, that the young embryologists with this generation is coming, they are really very fortunate enough that they have a good team of clinicians working with them. They understand. We are from the era when it was very difficult. It was a dominated field by the clinician, and you are liable to answer them for each and everything whatever goes wrong in the lab, without considering that there may be a clinical side also involved with the patient. So I just like to share here that because of this stress, like Krishna said, that one day all of a sudden he find the sugar so much. I discovered with condition which called dyslipidemia, and the same situation, because I used to go work lot, eat lot, uncontrolled, no exercise, and again there was no symptom. Only thing I was started feeling sleepy in the afternoons and some dizziness and like that. So as I just visited one of my friend pathologists here in Indore, he said, you get your blood test done. When he taken blood for something, he immediately called me after half an hour, Charu, come back, see. So I went back. He showed me the serum separated. It was like just more than ghee. घी से भी ज्यादा खतरनाक स्ट्रक्चर था उसका. And then he told me all the things related with it, and then I understand, and then we started doing this. So fortunately now the things are okay. Of course, कभी ऊपर नीचे होता है, but the things are controlled. And from that point of time, I have made it a point that that at any point, because there is a misconception, like for example, walking. You should go in the morning hours only for walk. I find out that anytime, whenever you feel, you find a road, you find a clean place, you find a job. Nowadays, it is very easy to find a garden nearby. You can go at any time. And okay, yoga and all other things, exercises that help. But my belief is if you walk daily 4 kilometers, that is good enough for you to give relaxation for all kind of muscular or this kind of relaxation. You can just go, come, sit for some time, read newspaper, give some time to yourself in the morning. And yes, of course, they say, Raju madam said yoga and other these things, this will definitely help. There is no doubt, absolutely no doubt about it. And as an incidence, if I want to tell, then there was one incidence which I know that because of the stress level, this, I don't know how much is dyslipidemia was involved with that, but believe me, I was so tensed during those days in work, and there was some misunderstanding, and something was going on with the center also where I was working. So I was stressed, and it was a very big question in front of me. What next? If I leave this center, where I will go? At that time, this freelancing concept was not there. It was just started. So I was coming from clinic back to my home on my motorbike. That was the time when I used to ride CD 100 SS motorbike. So, so I met with an accident. I don't know. Means till today, I don't remember how it happens, how that car struck me, and believe me, that was an life-threatening situation for me, because I fell down from a bridge. Down there was a stones lying there and all, and I got unconscious. I don't know who came, who take me to the hospital, And I was fortunate enough that that hospital belongs to one of the consultant to whom I know. So she immediately recognized, and then all cares were taken, and then the things goes on. So the whole point is that you have to give time to yourself. That is what the crux of this thing. Work is going on, as Krishna rightly said, nothing is going to stop. If you don't go for a day in the lab, it's not like that case will not happen. Case will happen, right? So relax. And again, another important thing I would like to stress here, the time when I started from last 4-5 years, of course ये corona period में नहीं हो पाया, but उसके पहले पिछले 2-3 साल से I intentionally started taking a break of 5 days, going out somewhere, spend time with the family, vacation, and coming back. Believe me, it changes everything. You should give some time, personal space to you, and that will help a lot. बाकी तो हम सब देख ही रहे हैं, but really again I want to tell, today the scene is totally different. If probably we were in this time, हम पता नहीं वंडर्स कर चुके थे, वो तो चांद तक ही पहुंचे, हम पता नहीं कहाँ पे आर्टिफिशियल और इसमें कहाँ से कहाँ पहुंच जाते. So this is the story.
Right, great sir,
Thank
wonderful.
you.
I think, thank you sir, it was great, because I mean the take home message I really find is that you need to give time to your family, that is very important, and take vacations. That too, I'm like, even I think we all are learning, myself I'm learning it the hard way, that there is no holiday and hamare vacations are conferences. I think those are not technically vacations. We should take proper vacations with our friends and family. That's
And
another story.
why doctors are only at the liberty to take vacation every year? Why can't we take? And
Very true.
and I would like to really hoping to listen from Swami sir that is some Goa planning is going on, and I think that's a game changer for all of us.
I think, yeah. So
We
I
should
think
be-
Swami sir
we
should
be-
unmute and start with his Goa planning. आप story बनाने के बजाय आप Goa की planning बता दीजिए.
Yeah.
So over to you, please. Sorry.
Yeah. Can you hear me?
Yeah, absolutely, loud and clear.
Yeah. Thank you, Ahira, for inviting me here. So, like, see, I'm little kind of philosophical person. I read a lot and I try to practice that. So every gain has its own loss. So how much I'm losing is very, very important for what. So it is up to the individual. I don't know whether it is fortunate or unfortunate. I don't have any story to tell you. Till now, I'm 54 years. I'm hale and healthy. I'm a vegetarian. You put me in footpath, I will sleep. You put me in 5-star hotel, I will enjoy. So I try to enjoy the moment. And you all know that we all started, maybe we are all boomers, like, oldies. We started our practice by making our own media. Imagine the stress. The main thing about all this issue is that we are very much soul connected to the embryos. Knowingly or unknowingly, when you start creating the embryos, we have a communication with that. Like, it is my embryo. We never said that it's patient embryo. I created blastocyst. Actually, I'm not creating. I can only fertilize it. It is growing. I will provide the parameters. But why I have to say my embryo? That is the connection. It is little beyond that, because creation is much, much difficult. There are so many things interconnected. You can repair the machine which is manufactured, but we are manufacturing the machine. So that is the difference between other medical sciences and our science. So how I keep myself cool is that, first thing is I read a lot. I listen music. And as I told that I'm a vegetarian, it's the food is up to one. I'm not forcing that. Mine is I'm well planned. I can't go to any place not even 1 minute late. I will get tensed. So everything planned. If I'm traveling, everything should be fixed. Even the seat where I have to sit. That's why I'm very particular. If somebody is fixing my talk in conference, I will ask 101 questions, like who is coming, what is the driver. Because see, that one more thing is the commitment. Like we committed for something. Like as I said. So our profession, see, every profession is having its own. Actually we have to call different professionals and ask them what they are doing to relax. For example, we can call the Veeramuthuvel from ISRO. So it is no, he has done his own job. Every field is having, only thing we should know how to balance it and how to, relax ourselves. Like, when age goes and the moment goes, we can't get it back. And we all know that we are doing a very, very great job and responsible job. But my policy is very, very simple. I don't want to do anything losing myself. So I am stick to that from the day one when I entered this, and till today, this moment. Today, 6:30, I had a physical meeting in Trichy. I finished the talk. Now I'm sitting in the room. I'm talking now. Night, I will drive to Chennai. Then tomorrow I'm leaving to Colombo. But everything is planned. I know tomorrow what I have to do. It is fixed. So this, I think we have to get to understand that, everybody is having only 24 hours, and try to divide. Give some time for you. And every Sunday I will switch off my mobile. I will not pick up the mobile. So I have to, because see, as you know that, I hardly stay with my family. But when I am with my family, 24 hours I am with them. I will make my children ready. I'll put them their uniform. I'll go and drop them down. So it is like that. Wherever I am, I will be there. So, that is my simple policy. I may be still, I lead a very simple life. I don't want to become Ambani. I have to die as Swaminathan. That's all simple. Thank you.
Lovely, sir. Very nice, wise words of wisdom. Love that take home message that yes, give time to your family, be punctual, and definitely, जैसे हम lab में करते, have SOPs in your regular home life also somewhere. I mean, it does help. We all have, I think, even me, I've become like, my house has become like a lab now. Everything is properly kept, everything is measured, everything is, time wise hota hai, sab hota hai. So I think that has somewhere changed me as a human being. I'm very different. As a lab person, as a scientist, I'm very different. So I go down, I have a different, like, aapka Bruce Wayne Batman ho jata hai. We all are the same. We are Bruce Wayne at home and we are Batman in the lab. And that's a wonderful thing, and that's how it should be, to have certain discipline and really follow what is going on. But somewhere thoda Batman life mein hona bhi zaruri hai, I believe. So yeah, with that I would like to
Nishad,
yes sir.
Gaurav want to say something, I think.
Yes, I'm going to Gaurav only actually. So just a small introduction that Dr. Gaurav Majumdar is with us, and everybody knows him. He is our ACE Secretary General. So I welcome him to the program here. Thank you, Gaurav, for being here, and please, the dais is yours.
Thank you. I tuned in to the CME, and it's been wonderful. It's so interesting and different from the usual stuff, but excellent. So great. Congratulations to the organizers, to Ved, and all of you for doing this. So so I sympathize with Krishna and Charu sir, that they landed up with health problems. And I'm probably one of the fortunate ones who still healthy, and despite the stress, we have, thank you. So we have very large volumes, at the place where we work. We are doing close to 1,000 fresh cycles every year and about 1,000 FETs. And obviously you all understand all the other, peripheral work which goes on with this. So very soon in my work, after a few years, I understood one thing, that freelancing, because there was a point in time when in Delhi, I was fully involved in my center working, and knew embryologists with a lot of zeal and enthusiasm, and wanted to do all the ICSIs and everything, and like Krishna said. But and at the same time, I was getting requests from a lot of other centers in Delhi to come in and do work for them. So I joined one center, and I worked there for 2 years. And after that, and at the same time, I would go in here and there. So number one, I realized that because taking the stress for going to different centers is huge. where you are the lone person who takes the onus of the entire lab. So just earning an extra buck is not enough compensation for that. So at that time, I took a conscious decision that I will not do freelancing. So I made this choice that this is increasing, this is making my working hours, incredibly, throughout the day, I'm working from morning till night, because obviously you have no time. You have to rush from a center, from my center, finish my work, and then go to another center. So I had to make that choice. And, we are ourselves to blame for this that is happening, because we think that it's some kind of self-gratification and, an ego boost when there are 10 centers or 15 centers who want your services, and we sign up for it. We are the one, nobody's forcing you to do this. We sign up for it, and later we realize that this is not humanly possible. And then unfortunately, we'll get all, issues with our body, with, land up with health issues. So very big thing that you have to decide that you have to work, how much work you can do, and which has to be a nominal work. And second thing I realized very soon was that as much as we want to think of ourselves as a Batman or a Superman or whatever, physically it is humanly impossible to maintain quality in a lab if only one person is in charge.
Yes.
So I understood that this is not a job which can be done by one person, and which every embryologist, every lab director in India who is working alone should understand. The moment there is too much work and I am the only one there, I know that my quality dips. Even after working for 21 years, my quality dips, and like how? So I understood that so in my lab, it is my responsibility that 4 people know how to do ICSI, not one. That 4 people know how to do vitrification, and they have not come from the sky. I have trained them. I have made sure the KPIs are good. And, in my hospital, the management said, we give you approval only for 1 junior embryologist. And we are going to pay you salary for only 1 junior embryologist. And I told them that, no, I cannot do 100 pickups per month and 1200, cycles a year with 1 junior embryologist. I need 4 people. And they said, sorry, the management doesn't allow to give salary. So I said, I will give them salary. So I made this conscious decision that I need a huge team, because only then I can maintain the quality. And where there are 5 people, then we do weekends by rotation so that people don't burn out. We can go to conferences, we can go to vacations, because there are enough people for backup. So again, this is our own responsibility that we have. And consciously, I decided that, okay, I'm going to part with X amount of money from my check, because this is not required just for my mental and physical well-being, but for the well-being of the work, for the quality to be maintained. And the day we come to terms with this fact, and we acknowledge the fact that if I am working alone in the lab, then my quality becomes terrible.
Yeah.
And if I have 5 people helping me at every step, my quality goes, wow, it goes to the roof. So there is no question of stress then, because I know even if there are 10 cases, 1 embryologist is not going to do more than 2 ICSIs a day.
Yes.
So everybody is relaxed. Everybody is in a right frame of mind that, okay, this is the job I have to do. The work is delegated to each embryologist. You have to do the sperm prep. And even in sperm prep, we make sure that 1 person doesn't do more than 2 sperm preps.
Oh, that's great.
Right? Because, the nature of the work is so monotonous.
How many cases do you do in a day, for example?
No, maximum we do say 10 cases a day.
Okay, fine. So, but you got 4 or 5. Then
but we have got so even if there are because see, we do about 100 cases a month which is over 20 days,
That is a lot.
right? 20 days.
Yeah.
So, but we make sure that there is absolutely no stress, that nobody gets tired. No, because the moment you do a lot of ICSIs, you start having blackouts. You start seeing black in front of your eyes.
Yes, absolutely. Very true. Yeah, it does
Right?
happen.
So we make sure that situation only doesn't come. Because the moment you are stressed, then mistakes will start happening. Then, then quality will start going down. Your KPIs will start dropping. Because unfortunately, the nature of the work is very monotonous and very repetitive.
Exactly.
And so it's very difficult to motivate oneself if you have to do everything. Right? So this is my story.
Lovely, great. I think it's a very good take-home message, and somehow I can correlate to you because even I have 3 people with me in the lab all the time, and the workload is, even though I do freelancing, I have the same like 4, 5, 6 centers in one, but I don't do more than 1 or 2 cases per center per day. So it's like, so that is almost less, like not even 10 cases like you're doing. I'm not doing that much. So my workload is also taken care, and my juniors are there. One will prepare the sample, one will prepare the lab. Someone will do the screening. I'll be there for ICSI, I'll do the screening. So we keep on exchanging the roles. So you don't get bored. You can do all the work and everything is taken care. And the best part is all the data is always there. You can do a lot of data logging there. So that is the most important part. And I think that is what we need to do. We need to delegate our work so that we will be relaxed. We can take holidays. We can go on vacations. So lovely story. Very good points. And I think we're falling short of time, but I think I'd like to take 2, 3 stories more. Rajvi ma'am, let's begin with yours. Your hand was up quite early. And I think after that, we'll have Keshav's story.
Yeah, basically, I don't have any fascinating or unfortunate stories to say, but
Ma'am, I would like to say one more thing. वो आपका योगा वाला और कंटिन्यू हो गया रहता है, मेरा बैक एक और ठीक हो गया रहता है. I was like doing it when you're doing it. Seriously. Yeah.
So it's very interesting to listen to Gaurav and say you have people helping you. And the fact is, my story would be when I started, I didn't know any embryologist. And after 7 years in the field or 8 to 9 years in the field, I mean, Charu will possibly understand what I'm saying, tried very hard to know. So the stressor was you had nobody and you couldn't afford falling sick. If you were sick, you had to work. You had people at home who were sick, but you had to go because you couldn't leave the cases around. And the stressors were very, very different. And you were totally dependent. You didn't have companies around who would get you stuff as and when you asked them. So to get them, so it's all very historical, but it brings to mind that the stressors were very, very different. Apart, we didn't have that heavy a workload like what you're having 1,000 cycles. Yes, in the beginning, when there was no IVF or 3 IVF clinics in the country, we were doing, even at that time, 400, 500 single embryologists preparing your own media. But the issue was that even when you wanted to discuss something, there was nobody around. I have approached so many clinicians. I knew most clinicians who were in the field. I approached them that, can you tell me who's your embryologist so I can discuss? And possibly you have realized by now, I am possibly started IVF before when many of you were in schools or possibly some of them not even born. So that was, and what did they tell me? The response was, what are you doing? Trying to create a union? The fact was that they were so scared to tell you who the embryologist was because moment they got, they would be harvesting. So the moral is that first is you need to be very confident of yourself, well-read, well-educated. I think that's what I started. So you could stand up for yourself, so nobody could question you. So if you are well-read, you know exactly what's happening. They had to listen to you. So we also had that time being a single embryologist. And fortunately for me, yoga has been part of my life since my school days. So even when we had cases, there were always those times, weekends off, never you had weekends. I mean, it was Murphy's Laws, you would have a pickup on Sunday. So I actually was very fortunate. I said, see, whole week, I'm not questioning. You're there morning to night. Sunday is my yoga class. You come and do the pickup at 6, I will do, come back later. And the clinician started coming at 5:30 to do that. Because you've given yourself for a whole week, 2 hours, you give it to me. So I think that was a totally different thing. There are a lot of advantages here. And I would just like to say that yes, the yoga bit surely puts in because we are all born with our disposition, with our genetics and all that. So possibly it does help in a big way. And finally, why stress? So the point is, it's very easy to say, don't stress. It's not easy when you are sitting there and things are not going and, So that's where I think the ability to handle stress comes in with the practice of yoga. So my message would be get into it, and it does help you, because it's all very well to say, but when it really you face it, it's very difficult not to get stressed. I mean, if you see 3 consecutive failures, if you see, that pressure is building upon you, next day, what's going to happen? So I think the performance pressure is very, very high. And although as much as we know that we are not the cause for everything, we cannot do everything, but still the question will be, nobody questions the oocytes and gametes. It takes a lot of time to earn the respect, to sit back and tell them, listen, it's also your stimulation. It is also the quality. But that doesn't happen overnight. You have to earn your respect before you can, sit on the same page and talk. So I think the message should be, and it's monotonous work. And to me, the monotony would be possibly the most boring thing, would possibly make me run away. It came a point that, okay, I don't want to do this. But I think what is exciting is seeing the potential of what can be done. Keep reading, trying to see what can be implemented. And sometimes I pity the modern generation where you have very, very strict SOPs where you cannot deviate a bit. So that's also a little problematic, possibly coming from research, and we had scope for deviation as long as everything was recorded. But otherwise, I think the monotony can kill you. Unless you keep reading, implementing, and looking at data and analyzing or something, possibly I would have gone mad. And when I felt that, I said, okay, it's time to switch over to something else, kind of thing.
So I do believe that we all go through those burnouts after certain period of time. And it's absolutely fine to go through it. Just, take it slowly and then you can come out of it. Even I had to go through it. It took me time. I came out of it and I'm enjoying every bit of it still, like I used to earlier. So nothing has changed. Like more than that, now I've got more zest for embryology now. I study more. I put more time in my lab, in my other work, in my theory, practical, everywhere. So yeah, I mean, it does make a difference. Just that you need to bounce back properly, have a good work-life balance, and have a good team. Keshav, I think with you, I have seen a lot of things. You have got it right somewhere. Like we're very good friends, and we talk a lot. And your health, and your diet, and your lifestyle. I mean, मैं ही तुझसे सीखता हूँ. I would rather say that I take tips from you. So the stage is all yours. What's your story, and how you'd like to help me out with this?
Thank you, Nishad. I also don't have like a very scary story for all of you. I mean, the things that I've heard today, I feel that I am lucky that health has been good, and touch wood. I mean, I hope that it stays good. The only instance that I remember, which really, I think there are 2 instances that I can talk about. One is related to work, and the other one obviously is related to COVID. So during one of the batches, it was a big batch that I was traveling to. And the thing is that I had to go to Kanpur and then take a train to Dhanbad and then work in Dhanbad and come back after 2 days. Lots of cases. I think there were more than 40 cases there, which were scheduled in like 2 days. And obviously the whole team had gone. But once we came back, I could feel that the little toe of my right foot, I couldn't feel anything. And that is where I was like, oh no, this is a problem, and I can't afford to basically lose sensation, obviously. And this does indicate that there were certain issues with the spine. And like everyone here has been talking about exercise, they've been talking about posture. That's when it triggered that, yeah, I mean, I really have to focus on posture. And there were times like that particular week itself, I was actually sleeping on the floor and not on the bed, because I wanted like a straight platform for my spine to just correct itself, and that's what the doc had also advised. So that was one, and that's when it actually triggered to inculcate exercise into my lifestyle. And that's since then, I think this is 2019. Since then, I've been really taking out time daily, one hour a day. I'm at the gym, and that's something that's been continuing till now. The second thing was during COVID. And I mean, obviously the first wave, we were stuck at home, and there was nothing to do. It took a mental toll on us. it took a emotional toll on us because there were so many people who were like losing their lives and you could do nothing about it. I was stress eating. I was binge eating like anything. I had left exercise at that point of time. I became, I mean, it might be a shock to all of you. I don't know. I gained 15 kgs in that duration. I was 84 kgs. And obviously there were no conferences at that point of time, so nobody noticed. So it was a good thing. But like those three, and this was in a duration of like 4 or 5 months that this change had happened. And again, there was, I think it was close to Nirali's birthday, who's my niece, where like one of my cousins took a photograph of us. And just looking at that photograph, I had like a big double chin at that point of time. And I was like, oh no, this can't happen. So that was the second thing that really triggered me at that point of time. And since then, I mean, I made it a point that I'm going to lose this before the year ends. I was back to 70 within that year, 6 months. I lost those 15 kgs. I'm maintaining this weight now. And that's it. I mean, because I mean, I've had a good team. I like all of you. I also have 3 more embryologists in my lab who assist me, and they're all trained in ICSI, so I can take breaks whenever I want. When they want breaks, I don't stop them. If they're not taking breaks, I force them to take a holiday. And these are things that as lab directors, we have to make sure, because it's not just our health, it's also their health that we have to really consider. And just make a good routine, make a good regime for yourself, eat well, exercise at least 4 times a week if that's possible. Travel is something that I don't think we can restrict, but we just have to now try and manage our routines with the kind of travel and with the kind of hectic lifestyles that all of us have. That's it.
Great. That's a good advice. What with travel, I think I'd like to add is that if you've got a conference, I like most of the time, I think we've discussed this. All of you have discussed this a lot. Is that a bus flight miss hone wali thi? Yeah, tomorrow morning I have to reach because I've got pickups. So this have stopped now. I take
Yeah,
one more day
it
off,
happens.
on the other side. No pickup on no pickup or transfers at least 24 hours before I travel. So you go
Ace
in.
Delhi. Ace Delhi last year, I was doing up down from Agra. I was finishing my cases. I was coming and attending the conference. I was going back doing my cases. And this is because I wanted my team to attend the conference. So I was like, I'll
They were
manage
there,
the
right?
case.
Yes.
So all of them were there. I was going back and forth. But I mean, these are certain like sacrifices that you would like want to make for all of them as well, because they also deserve it.
Right, absolutely. So it's a nice thing that we all are doing, especially the lab directors here, that yes, that culture has come where we have started taking care of our team, whether it's regarding their food schedule, their health, their mental stress and pressure. So I think that is also very important that we all need to take care of, maintain their basic condition, maintain our basic conditions. And I think that's the only way we'll be able to, live a very fruitful, healthy, and prosperous, and probably a long life. So let's hope for the best. And with that, I think, Vakil, I think we've got some more things to do right now. This last one is the introduction of our speaker.
Yes. Yes.
So
Yes. So
would you like to take that ahead?
Can I just add 2, 3
Yes, sir.
things
Please go ahead, sir.
yes.
Yeah, so what I feel here after listening to all these people, see, basically this is another part of this entire story, that whenever people like us who are working daily for 7, 8 hours, and when a holiday comes, like for me, I'm telling about myself that whenever there is an off day or a Sunday and I'm at home, I have the tendency of just, I started feeling like hungry. I don't know why. And whole day something should be there to eat. So that also creates problems. It's not like the stress is there only in the lab. It is at home also. If you are sitting free without any work, then it prompts you to do something or other thing, or just go on eat something or drink something or something like that. The
True,
second,
true.
second important thing I would like to
But
point
Charu,
out-
it doesn't show on you. You are still very healthy. It
No, no,
doesn't show on you.
no, but see what you are eating and what quantity you are eating. That makes the difference. मैं
Indeed,
खाता हूँ,
indeed.
मैं दिन भर खाता
I've
हूँ.
got a solution for that, which actually works for me. So
हाँ.
when I used to feel free, see, I'm a restless guy. If I'm sitting free, I cannot just sit free. Sunday head, chill and everything. And the one thing that I think probably we all forgot is vocation, that we should have a hobby. All of us, is that whether you've got a weekend off or after 6 hours, 8 hours of work, continue your hobby. And that is what I did. I love filmmaking. I did that. I love to sing. I did that. I'm like, whatever. So maybe that is what we need to do, is not just sit like, yes, stress eating hota hai, ya fir, you're getting into something else. So rather utilize that time with the family, or, do painting, you sing, you go out, travel, whatever you like. I think that free time has to be properly utilized, which probably we are unable to do it because we are very much tired, mentally and physically. So if we are able to figure that out, I think we've got a life sorted. I think with that, let us move ahead. And Vakil, would you like to please go ahead with the introduction?
So first of all, I would like to thank all the panelists for the group discussion and making it a really interesting and wonderful session. So now I would like to introduce our moderator for the session, Dr. Rajvi Mehta, and she will introduce our next speaker, Dr. Avisa Asemi from US, and she will be giving us a session on occupational hazards and health of an embryologist. So over to you, Dr. Rajvi. So the CV is there, so please introduce our speaker.
So after this very interesting discussion, a lot of personal stories and telling us where we are heading for, I'm really looking forward for this talk by the Dr. Avisa Asemi. She is a lab director, clinical embryologist with over 8 years of experience as a lab director. One thing what is fascinating from a CV is she has done a PhD in complex systems and brain sciences. So she possibly understands much better than us. We are only talking from our experiences, but she possibly understands how these jobs can, and the occupational hazards of this job, what we are doing, how the monotony with what we do, how the stressors affect their brain. She possibly has a different insight. So it's going to be very interesting. So I'm not going to take away time from her. She will speak for herself. So over to you, Dr. Asemi. Really looking forward to your insights.
Appreciate that. I try to bring my, okay. Perfect. Okay, thank you so much for your kind introduction. I really appreciate that. And thank you for inviting me for this important talk. And I'm really honored to talk about the health of embryologists and the occupational hazard in embryology lab. I'm going to start from our lab safety, and I heard all of you mention about your experience in the lab, and all of us had such experience, and we are so familiar with that stress and tension. But we wanted to have your attention to your lab safety protocol, that your lab safety protocol is not enough. You need to add more stuff to your lab safety other than your infection control, exposure control plan, and OSHA bloodborne pathogen standard. These are the universal and these are the standard, but in the new era of embryology lab, which we are doing more than 20 years ago, probably we need to have better lab safety for our embryologists, for ourselves, and we need to just adjust that to our embryology field, and everybody going to understand that this is not going to be enough to protect our embryologists just from the infectious diseases. And I know that recently the ergonomic chair and ergonomic policy is very common in the lab. Thanks God that the CAP is just forcing that to embryology labs, that they need to have ergonomic policy and they need to show that they apply the ergonomic policy. But again, that is not going to be enough based on the tense and the tension of the work and nature of the work that is going to tear and wear off embryologists during the years that they're going to work behind the microscope for long hours of ICSI and biopsy. Therefore, I'm going to propose that we need to add this lab safety protocol to our lab safety, that we need to have the emotional, psychological lab safety protocol. Means that how we going to support our emotional and psychological issue in our lab, and what is our plan and what is our protocols. And these are very important. I'm going to talk about this during my presentation. And then the second one is we need to have a mental health plan for embryologists. And that is very important, and we shouldn't ignore this, because nowadays, if we keep our embryologists from infectious diseases, we need to protect them from the stress and all of these stressors that comes with this type of job that we do, and we need to protect them as well. And we know that all of these stressors and all of this anxiety and stress going to cause a lot of illnesses, and we saw lots of examples ahead of a time that people told the story. Therefore, this is very important for all of the lab inspectors, all of the lab director, to understand that these are the must. We need to have these in our lab safety, and we cannot ignore that. Another thing that I recommend to all of the lab directors, and especially inspector, when they inspect the lab, to see that the lab has a panic plan. Panic plan means that when you having the few cycle of like a retrieval, after many years, you're going to get somehow raised. What is your plan for that raise? Sometimes after 2-3 years, your center doing well, and the patient come to you, and you need to have a plan. You cannot go on with the same number of embryologists that you have to do the like 100 cases, 200 cases. Out of the sudden, you become the 500 cases, 600 cases, and you're going to work with the two embryology. That is impossible. And that is going to make a lot of pressure on our embryologists. And we don't want that. We want, as a lab director, to just protect health of the embryologists. As all of these lab safety plans that we have, and we apply it to just protect our embryologists. Therefore, if we protect our embryologists from infectious diseases, we have to protect them from the any stress and the anxiety, anger that comes in the lab because of too much work that we force to them, and we don't have enough embryologists. I know that there is a shortage in senior embryologists, but we need to understand that we need to train them. We need to understand that we have to make our plan anything that is possible. Sometimes we have to have a waiting list. Sometimes we have to just we cannot have this many cases. If you cannot hire, you don't have enough budget to hire more and more embryologists or lab assistants, you need to just stop somewhere and have a waiting list, and don't put the pressure on your embryologist. And this is very important. And this is supposed to come from the inspector. Some people that are going to control the labs and lab directors and the fertility center, then they can force all of this to these centers, that they couldn't just take advantage of these opportunities that they have, and then force that to the embryologists that are working more than 8 hours, 15 days in a row without any time off. And these are all wrong. And we shouldn't let that happen, because if we care about our embryologists don't take any viruses from our lab, we have to be in care for our embryologists that don't take any of these anxiety disorder, depression, and this what they call it, like a stress diseases that comes after, because we went through a lot. We have to take care of our embryologists. Something else that I would like to mention here, that when we have a lot of turnover in our lab, that is going to cost for our center 1.5 to 2 times of our embryologist salary. And that is very important, that is not only cost that fertility center going to pay. The another cost that fertility center going to pay is going to have a lot of stress on our embryologists, because one embryologist should cover for 2 or 3 embryologists, and that is going to be too much because of the nature of job, and you are as embryologists understand what I mean. Another thing that we have to avoid is a toxic embryology lab environment, and all of us somehow work in some lab that it had a toxic embryology lab environment, and that is something that going to make our embryologists more tired and more stressed out, and going to have an effect on their physical, emotional, and psychological health for the long run. And this is very important as an embryologist. If you work in such a places, you need to think of yourself first, and you are in priority, and you need to think for the plan B. And that is important for our lab director to make sure that their lab are not going to be toxic embryology lab environment. And that is why I'm going to propose here that only having a PhD and master degree with more than 8 years of experience in embryology lab are not going to be enough anymore in this era to running a lab like embryology lab that has this much complexity. We need to have the leadership courses, and these are the essential and vital for running any fertility lab, because you are going to work with a lot of people in your lab and with a lot of stress that they're going to work under. Therefore, this is very important that the lab CEOs and all of the fertility centers medical director to understand that these leadership courses supposed to be taken, and they need to invest for their lab director to go to these courses, understand the strategy of the lab leadership, and then the principle of the lab leadership, and they come and apply that to our labs. And I think that we missing the lab leadership in our labs. And because when we get our degree in our school, university, they never ever taught us to become a leader. We never ever got any leadership courses. Therefore, nobody going to tell us that what we can do in this such situation. And sometimes we are very confused because we never had that situation before. Therefore, this is something that I really propose that you ask your medical director to invest for you for these courses, and because this is going to help you to make your decision and have a healthy lab environment, which is this healthy lab environment going to help the people that who works for you become healthier and less stress they're going to go through. Another thing that I'm just asking the medical director to make sure that before they hiring any lab director, they make these leadership tests that is very just common, that they can find these leadership test for the beginner, and ask their lab director before they hire them to just take this test and see that where do your lab director stand. This is very important. And then another thing is psychological tests. We want to make sure that our lab directors are going to be in the good understanding and in a good emotional health. And this is very important. And that is something that I recommend after you hire your lab director, and then you have them, same as you're going to review your embryologists annually, the embryologist is supposed to review the lab directors as well, but anonymously, because then as a lab director, you're going to see what is going on in your lab and what the problem you have that probably you couldn't see it yourself. And that is going to be the best way of improvement for your lab leadership skills. And if you need to just have that in your leadership skills. And I really recommend that. And don't be scared to have that review from your embryologist. I know you're going to see probably few things that you don't like it, but take this as a leadership step that you're going to use that to make yourself better person to lead your lab. And if there is something that you didn't know that you need to change it, and that is going to be help you, and your people that you lead going to see you as a true leader and going to follow you and trust you more. Another thing is you need to be a good listener, and when the people come forward forward and talk to you, you need to take action and show them that you care about them. Another very, very important point is don't do the micromanagement and quit the micromanagement if you want to have the healthy lab environment. Because if you just sign them off to become a lab senior embryologist, sorry, then you can just trust them to do the best job that you train them, and don't just stand behind their back and see that how they do. It's going to be bad for you, because that is going to have a lot of stress on you and on the embryologists as well. Then they cannot work under this much stress and going to be unhealthy for all this embryology. If you think that they're not good enough to do this skill, then you shouldn't move them up, and you're supposed to stop them. And that is another stress source that we add to this embryologists, that they're not ready, and we move them up because we need more people to do ICSI and biopsy. Therefore, that is something that we have to stop and make sure that they are ready to go on. Another very important thing that I would like to mention here, that I saw that sometimes medical directors going to just promote some people based on their skills. They have a good just ICSI or biopsy skill, top notch, then they're going to make them lab manager. That is completely wrong. You're going to add another stressor to your lab, because that person doesn't have a qualification to be a lab director and a lab manager. And that is something that going to make your lab more toxic. And if it go far, you cannot control that very well in future. And that is very important. You understand that. I know that this field is very new field, but this is a very hard, has lots of complexity, and we cannot ask somebody that doesn't have a degree, doesn't have any management experience to run our lab, because their ICSI or biopsies go, and we don't want to lose that person. Another very important thing is we need to have a life-work balance. And life-work balance is, as you mentioned, is very, very important in embryology lab, because we work under a lot of stress. And we cannot put this stress on our embryologists because we don't have enough embryologists, or we don't have like a budget to hire new embryologists. And this is something that we have to stop, and we have to understand, all of us from top down, that this is not working for a long run. And that is going to be bad for the fertility center, because these people going to make a mistake, and then fertility center is supposed to pay that lawsuit and so on. And any mistake in embryology lab going to be catastrophic. And we have to stop it and prevent it ahead of the time. And these are going to be somehow some preventions that all these CEOs needs to think about it. And another thing is the short breaks. I'm going to here emphasize that you need to have a lot of short breaks in embryology lab, and you have to encourage your embryologists to take a short breaks. This is very important, because without short breaks, we're going to switch to autopilot mode, and this autopilot mode is going to make us to make more mistakes. Our brain is just have the capacity to work in a very short time in a stress situation. We cannot force that in the biology. Biology talk to us. They show you that your brain cannot work, your body cannot work under the stress for a long time. And that's not going to be healthy for you. And you think that, no, I can do it. You're not Superman. You're not superhuman. You need to have a just short break. I know that embryologists want to live after 8 hours. And if they have a short break, they told me that, no, we cannot finish it in the time. But that is something that you're going to ruin your health, which is your health is your priority. And the health is new understanding of form of the wealth. Then that's something that if you lose your health is very expensive to just bring it back. And therefore, all of us as a lab director needs to understand that the short breaks is very important in the embryology lab. And don't sit for 2-3 ICSI at a time or biopsy. You need to have a good short break and just get some air and then come back and continue. And we are, as a lab director, we need to be supportive for our embryologists. And if our embryologists ask a raise, it's better you pay the raise instead of hiring new embryologists, because that's going to cost you more. And plus, you're going to add more stress to your people and your team by doing this, because your people see that you're not supportive, and they are going to have a lot of stress to make a decision that if they're going to be the next, what step they have to take. And then you need to encourage and empower your team. That is going to help for their emotional and psychological health. And again, you need to optimize your cycle. And that is something that panic lab plan that I was talking, it comes to play. And you need to have a short time or long time plan, what you're going to do if your cycles double or triple after some time. And you need to have that in place and be ready for that. And don't ask your embryologist to work 15 days in a row, because you don't know what you're going to do, and your medical director doesn't give you the budget to go forward. And these are the things that I think our inspectors, lab inspectors, come and see if they have, the center have 500-600 cases and 2 embryologists. That is something that they need to do, and they need to just report, and then they need to have some way of warning, and then another step as well on top of the warning if that goes on. This is same as we take care of our embryologist health for infectious diseases. This is very important. We need to take care of our embryologists about the extra stress and the extra anxiety that we're going to force them because of the situation of the lab. And therefore, by just mentioning this, I'm going to offer here that most of you as a lab director or as an embryologist, please go back to your center, ask your lab director, or you as a lab director, just go and apply the psychological and emotional safety protocol for your lab. And means that you're going to have a plan that makes your lab very safe condition, and the people could come forward and ask you a question, tell you the concern, bring you the positive and negative feedback. And these are all help your environment that become healthier and happier. And you're going to have an efficient embryology lab, because people think that they are important. Their ideas are count. And the best people that you can ask how you go forward is going to be your embryologist. Your embryologist's opinion is going to be so important than other people that you go to the even conferences, because that people know how everything works in your lab and what need to be changed in your lab to become more efficient. Then if you consider this psychological safety protocol, then your people going to work better, and then they're going to deliver their best work, and then you can trust them. And one more thing, that you need to honor the frankness and truth telling. This is very, very important, and you need to encourage people to come forward and tell you what's going on, and tell you if they make a mistake, because you know that every mistake is going to be catastrophic and you have to prevent it. And this is something that you can do it by being the good listener, and you show that you care. And all of this comes from being the leadership. That's why in the beginning, I just offer that all of us need to take these courses and read the leadership books, and make sure that we're going to apply that in our lab. And that is very, very important. And then you need to notice and acknowledge what's going well in your lab, and you need to have a reward system. As a reward system, it could be raised, but it could be that just you ask your embryologist that leave the half a day if you don't have anything to do, and give them this time they go and energize and spend their time with their family or exercise and so on. This is very important. Just buying the lunch is not going to be a good bonus for them. They need to have the time for themselves. And if you don't have that much time, just do the things to do in the lab, then as a good leader, please ask them to leave half a day. And then that's going to be very helpful for their health and their emotional and mental health, that you help them to be more become relaxed, and then they can come back energized and fuel up and for the next day. And then you need to have a lab that is going to be safe for the learner. That is very important, because you cannot ask your senior embryologist to just train junior embryologists when your senior embryologist is very busy to finish the day, and it has a lot of stress on that senior embryologist, and the junior embryologists are going to go to a lot of stress by this because they couldn't learn enough. And that is something that you need to invest on your junior embryologist, to send them to this learning classes and academic, instead of asking your senior embryologist to do this training when they have a lot of other things to do. And these are something that is going to make your environment more healthier if you consider all of these points that I mentioned. Another thing is emotional safety protocol. The emotional safety protocol means that you're going to have a safe social connection in your lab. And that is very important. This means that your people in your lab are friends with each other. They're not compete with each other. Don't make a competition. Don't think that if you make a competition among your embryologists, you're going to win at the end. No, that is completely wrong. This is the one that you need to stop, and because that is going to make more tension and going to make more anxiety on your people, and you don't want to have another stressor on your people. You want to have a calm and happy environment that people can focus on their work, because embryology lab has its own tension and its own stress by working with the eggs and embryos and doing ICSI and biopsy by itself. Therefore, you don't want to have that competitions between your embryologists. And then you need to make sure that you understand your embryologist contribution, and you're going to make the trust between your embryologist and yourself. And that is very important, that your embryologist trust you as a true leader. And then they're going to follow you. And then the trust going to build between the embryologists as well. Then that is going to help for the team working. If you wanted to have a good team working, then you need to make this friendship between your embryology. Don't make the competitors in your lab. That is wrong. And that is something that we have to stop. And this is something we need to have, that to make this relationship, then the senior embryologists and junior embryologists, when they finish their work, they're going to go and help each other to finish another person's work that is still continued. And that is something that we need in embryology lab. No one can leave embryology lab without helping the others, and communication is the most important thing in the embryology lab that we need to consider. And with having this social, safe social connection, we can make this better and better. And this is something that we need to develop. And then you need to promote the diversity in your lab. And of course, then you need to create a space for positive and negative feedback. As I just mentioned, the negative feedback is going to help you the most, because you could change your environment of your embryology lab to the way that all of the embryology want to stay. I listen when you listen to your embryologists, they're going to tell you that sometimes the environment is going to be so much more important than raised for them, because they want to work in the place that they don't have extra stress, and they want to have a friendship, and they want to have connection with other embryologists and lab director. And sometimes we have an offsite lab director and just a senior embryologist running the lab. And these are the things that it takes harder and harder for embryologists, because there is no good connections between these people and the lab director. And sometimes they have some questions that they want to ask the lab director. They have to email lab director and to wait to the answer to come back. And these are things that you need to consider if you want to have a healthy healthy, happy environment for your embryologist. And then you need to recognize the burnout symptoms, and for yourself and for your team as well. As embryologists, we all went through this burnout symptoms a lot, but because we didn't know that these are because of the a lot of work and stress that we did, then we couldn't recognize them. Yeah, the stress and working long hours could cause us the burnout. Yes, that is very true, and we have to accept this fact. And then going to wear and tear us on our body and mental health and their emotional health. And if it couldn't make this ease up, that is going to add and accumulate in our body and make it toxic, and then we're going to get sick. And these are all based on the literature and studies, and this is something that we need to make sure that we understand in our lab, and we run this lab as true leaders, and we could make their lab with more optimized working situation for our embryologists to just avoid the burnout symptoms from our embryologists and even ourselves. And this is very important because you're going to stop embryologists to become in their autopilot mode, which is very, very dangerous for your lab. And if the mistake happens at the end, your center going to answer, and the center going to be in a jeopardizing of closing. That therefore you need to make sure that if this symptoms you see between your colleagues and in your team, or if you see these symptoms in yourself, you need to take action and you need to seek support. You need to talk to your medical director. You need to talk as an embryologist, talk to your lab director, and make sure that they care about you and make sure that they listen to you. And if something happened, that is going to be the best. But if nothing happened, then you need to think of another options that you could have, and think of yourself in first, because you are first, and put yourself in priority, because you are more important than the job that you do. Because if you couldn't be healthy, then you cannot do your job in the best way possible. Therefore, this is very important, and you need to make sure that you are healthy and you're not going to be depressed, or you're not going to go under a lot of anxiety, because then your concentration going to decrease, and all of this going to make a lot of mistake. And then in long run, you cannot work and live like this. Believe me, this is going to have a long-term effect on you, and you need to stop that, because our body doesn't design to work under this much stress and this much anxiety, and we need to stop it. And then we need to make sure that we understand that mental health problems among the embryologists are serious. We have that. We have a depression and anxiety disorder because we work in the condition that we go through a lot of anxiety, a lot of depression, a lot of responsibility. And these are very important that we have a plan ahead of a time to make sure that we have a survey that embryologists fill this anonymously, and then ask some psychologists and psychiatrists to read and study that for us and see what the extra stressor do you have in your lab that you don't know. And that is very important for every lab director to measure this level of the stressors and reduce it in any way possible. From talking with your lab CEO and your center CEO to make sure that they're going to understand the situation in your lab and the stress that you have in your lab. And in this perspective, you can just take care of your embryologist mental health in proper way, and you can just provide them with more services that they could just go through and just get more help, because we all need that help. And that is the fact, and that is based on all the literature and studies that our body under the anxiety and very stress going to wear and tear, and we need to have some just backup and and we need to have days off, and we need to have to do something that we love after our very stressful day. And these are all based on the science, and we need to take it very serious. And we need to reimburse our embryologists for their exercise classes that they go and their yoga classes they go, because we need to show them that we care about them, and that is going to help the embryologists to feel better for themselves and help them to have less anxiety and less depression. And they're going to, believe me, stay with you because they think that you care about them. They think that this is a good place to work, and they're going to have the healthier and more better lifestyle when they work for you. And that is something that all of us supposed to just have it in our lab, and we need to discuss this type of the lab environment with our medical director and CEO to make sure that they understand it and they're going to invest in our embryologists, because 7 minutes of cardio could make you just help you to have less depression. And this is based on the study on the brain and depression. This is something that we need to understand and let the other embryologists and other directors know that, therefore we can go forward to have a healthier and happier and efficient lab. And that is something that I would like here to mention, that the people who works for us, that these people are very important, and we are not machine, and we cannot go through this much stress, because our body going to show us the manifestation we have from this much stress and this much anxiety that we go through daily. And this is going to show in the long run or short run. And this is something that all of us as a lab director are supposed to understand and go and have the proper lab safety manual that makes sure that our embryos are going to be happy and healthy. Thank you so much. I'm ready to answer all of your questions. And if you wanted to reach me through the LinkedIn, that is my LinkedIn just link. And please invest on your embryologist, because your embryologist is backbone of your fertility center. And if you have a healthy embryologist, you're going to have a better fertility result. Believe me. Thank you so much.
Thank you,
Over to you, Dr.
Dr. Wonderful talk. And, speaking about something which is rarely spoken about. People management and getting along people is the most difficult thing. And if you are going to your place of work, whether it's embryology anywhere, and you're not happy to go there, but you're going out of compulsion because it's your job, your livelihood, I think half the purpose of life is lost, because you are living life to earn, but you are not happy with the current life, and who knows what's going to happen about the future. So I think it was a brilliant talk, very, very rarely spoken about. So thank you. And I think the message is loud and clear. As seniors, one needs to make sure that you make the life of your juniors comfortable, understand their problems. And the easiest way to do is that every senior in this room has gone through this. They have started somewhere, but we have forgotten. So we have our memories of our struggles. We have memories of, how difficulty we faced and how we came out of it. Let's remember the difficulties we faced with people when we started, when questions were raised at us, when fingers were pointed at us, how we did not like it, how when we were not appreciated for what we did. 9 good things done, nobody's appreciated. One minor mistake and you are bombarded with it. If we remember that, I think if we follow that and we talk to our juniors, automatically they will understand that you are appreciating them, you are understanding them. And that is going to make a big difference, because they feel they are being understood. Another problem that I'm foreseeing now in the future is that we have organizations where the embryology is led by an embryologist, but often decisions are taken by management who have no idea about the field of embryology. And this is a big danger, because if you have somebody who has management skills, management knowledge, but no knowledge about the subject, they're going to mess up things. And one example of a complaint, or I wouldn't say a complaint, a discussion that I had with another embryologist was that this embryologist comes on a Sunday to equilibrate media for the next day, which is normal. So she spends 2 hours of her time to come to the lab to do for work next day. The management tells them, why does she stay for only 2 hours? She has to stay there for the whole day. She says, what will I stay for the whole day and do? Saying, no, stay for the whole day and take another day off, or finish your work on Friday. Now, as an embryologist, all of us will find this is such a ridiculous suggestion. I mean, how can you finish and why should you sit there, waste your Sunday just because they can compensate for the holiday? So I think this is a message that when people are working in this field, we as embryologists need to stand up and say we are going to be answerable to fellow embryologists or people from the ART fraternity, technically who understand us. Because this is a big danger when people have the leadership skills, they have the power, but they don't realize what's exactly happening, or let everybody spend some time in the lab from outside to see what we do. So I think it's been a wonderful session, and thank you, Dr. Semi, for highlighting these issues, which somewhere are there in the back of the mind. Everybody's seen it, but you brought it out so fluently, so well. Thank you so much.
Thank you so much. Appreciate
Thank
that.
you.
Thank you.
Thank you, Dr. Ashvi. It was wonderful, excellent talk. I think everyone enjoyed it a lot and understand how difficult to manage the things, small things, and how we can improve ourselves, our team members, and how to behave with our fellow juniors. Thank you so much. It's a wonderful talk.
My
Thank
pleasure.
you.
Thank you.
Nishad, you want to say something?
Sir, yes, definitely. It was Dr. Avisa, it was a wonderful talk. And yes, I agree that all these things are very important, from your SOPs to your communication to what Rajiv ma'am said about the management. It is very important that we take care of all these things. And the most important thing is, yes, as you mentioned, is the embryologists themselves. So yes, we have to take care of ourselves and our team. That is the only goal of our life.
Thank you. I think Nancy, yeah, please call Dr. Charu is there now?
Yes.
I would like to call Dr. Charudat Joshi to conclude the session, all the sessions, and vote of thanks, and for vote of thanks.
Thank you, Nancy, and thank you, IHERA, to provide this platform. Once again, it's a wonderful thought given to this, and this was an area which was not touched by anyone in last decades. I don't remember any meeting was happened who focused on the physical and mental state of the embryologist. So it's a wonderful day, and so many things to learn. Although I spent 25 years, but today I started feeling that yes, we are still there is a scope of learning from this young generation coming up. They have their skills, they have a good understanding of the subject, they have good communication skills, the clinicians are also supporting. So on behalf of IHERA, before concluding this, I would just like to conclude some remarks which we have seen and which I feel that it is in favor of our fraternity embryologists. One, thank you very much, Rajvi Madam, and this is what I have proposed in our management committee meeting of Academy of Clinical Embryology, that there should be, instead of morning, we usually have morning free paper session where only the speakers were there and no other person is there, because there is not much of interest. But if we devote a slot of half an hour in the morning session from say 9 to 9:30 for yoga for embryologists or clinicians, probably we will have a better attendance. And that is one way, it's a good thing for all of us. Similarly, releasing stress in different way, whatever way, it is very important, and it has to be understood by the embryologist fraternity that it is required and it is need of the day. They should relax. Of course, it depends on the workload and everything, but then still, work is work, and wherever you are doing 1 case or 10 case, it doesn't matter. You are responsible. You have to do responsibly. And the third important thing which I feel is that from your side, you are conscious, you should always keep clear that I would do my 100% best what I can do for the embryology or in the lab. Now, everything I cannot control. Even if I think I will have ideal lab, I will have ideal conditions, I will have ideal culture conditions, everything under my control. It's not possible. It's not going to happen. So some way or other, you have to give your 100%. Rest everything you can just leave it, because if you are giving your 100%, you are maintaining quality, results are bound to come, and that will give you a happiness from inside. So with this, on behalf of IHERA, I would like to thank all our speakers for giving wonderful suggestions, wonderful talk, wonderful stories we have learned. Uh, I was just thinking of that. I am very fortunate enough that in 25 years, I have not developed this cervical spondylitis. And probably I started feeling that I might not have that much of workload, or I might not have done that much of work. I'm not having this problem.
Sir, kismat wale ho aap.
It's my luck, you can say. So thank you very much. Thank you very much, everyone, for giving inputs, and see you all up soon. And I hope in future also we'll have focused such kind of webinars on the health issues of the embryologists. And of course, yes, this is very important take home from here, that intercommunication should increase, which I feel still is not there. Like I just want to say one thing here. When I visited Belgium in 2004-5, that time I used to see that culture was there, that every Saturday there was a group meeting of the entire team of IVF lab, or the complete, including clinicians and everyone. They used to sit, have a cup of tea, discuss some lighter moments about the patients, and so there is a well understanding. No blame game was there. Okay, yes, this is the case, this was happened, now again this case we are doing. So communication is very important, and yes, we are there. So always we are open, we should talk to each other. Probably that is another very important, you can say, by which we can release our stress. If I have someone to talk to, I think that's enough. I just express my things to him or her, and I will feel relaxed. So thank you very much.
Thanks to Cooper Surgical also.
Thanks to Cooper Surgical for giving this wonderful thought and bringing into reality. And yes, in future also request you to have such wonderful webinars again and again.
Indeed.
So, once
I think Dr. Nidhi wants to say something.
Thank you, sir, for those words. And sir, I just wanted to say what I've understood from all our seniors. I would thank everyone, whether it is IHERA or all the faculties in all the places. You have made it possible for our generation, so that the clinicians are more humble to us. So they really listen to us. And because of you seniors, I would say that this platform or any other platform also, you have got embryologists to that level that we can work hand in hand with our clinicians, and we can discuss everything, and they share the burden with us. That blame gaming has reduced a lot, sir. And two things I have learned from my senior is, one is patience, which I duly lack in many of the cases, and second is having a peace of mind, which I can see Rajvi ma'am, Ved sir, anyone here, Charudat sir, you have a lot. All of you have a lot of it. So thank you for being the seniors which we needed at this time and in this era. Thank you.
Thank you.
So, over to Vakil.
So thank you, sir. So from our side, I would request Aditi to give the vote of thanks from Cooper Surgical side. Aditi, over to you.
Thank you, Vakil. What a wonderful session it was. And I'll just take a moment to thank everyone on behalf of Cooper Surgical and on behalf of entire embryology community. I would like to thank all the speakers for sharing their experiences and stories. It has been really comforting and pacifying to let us know that, okay, we're not alone in this struggle, and really blessed to have such seniors around for guiding and mentoring us all the way. So thanks a lot. And especially thank you, Rajvi ma'am, for showing us some really quick and effective yoga postures, which I think would be, we can be doing at work also in those 5-10 minutes break when we get some time. So thanks a lot. Thank you, Dr. Avisa, for sharing your valuable insights and sparing your valuable time. And thank you, IHERA. It was a privilege to be associated associated with you in this wonderful initiative. Thank you, Dr. Ved, Dr. Charu, and Dr. Sanjay. And I'm really sure this was one of its kind. I I feel that, you know, back then when I was an embryologist, when I was a newbie in this field, I don't know why people didn't organize such webinars. This was really one of its kind, and I look forward to have many more such webinars. And I think all of us are going to take home a message that it's really important to prioritize our physical and mental well-being. So once again, thank you to everyone for this exceptional experience. Thanks a lot. Thank you.
Thank you so much. Thank you. डॉक्टर रजवी, एक क्वेश्चन है आपके लिए. आप मुझे बताओ कि कोई पर्टिकुलर टाइम आप सजेस्ट करना चाहोगे योगा के लिए, या एनी टाइम यू कैन डू द योगा?
Well, one condition would be you can't do it after food. That's it. Baki to at least 3 hours. Early morning, whenever you get time, start. ऐसे भी जो मैंने दिखाया, it's something so simple that it's not going to really affect.
नहीं डॉक्टर वेद, ये इसको ऐसा बोल सकते हैं हम, जब जागो तब सवेरा.
नहीं
बिल्कुल बिल्कुल ऐसा है. यदि तुम टाइम सोचते रह जाओगे तो यू विल नेवर डू इट. अरे अब तो देर हो गई, अब तो ऐसा हो गया, अब तो ऐसा हो गया. नहीं, जब आया दिमाग में करना है, थोड़ा सा करके छुट्टी करना है. And by the way, Cooper Surgical, I would like to thank you once again for this initiative. But there is one suggestion अभी बैठे बैठे मेरे दिमाग में आया कि why can't Cooper Surgical take this initiative to organize an yoga class daily or maybe on weekly basis or on once in 15 days with Rajvi madam for embryology?
Indeed, sir. It will be a privilege and it will be an honor for us. And
बहुत अच्छा हो जाएगा. It will be
definitely.
And believe me, because it is for embryologists by an embryologist.
Yes.
Okay, so people will be more interested. I think.
और मेरे ख्याल से वकील आप ये भी कर सकते हो कि एटलीस्ट फॉर अ मंथ आप कंटिन्यू करो उसको, फिर ब्रेक दे दो.
Issue is not the organization. This is like what you would call, when you hear all this, we feel get interested. What in yogic terms I'll call smashan vairagya. You know, smashan में जाते हैं वैराग्य हो जाता है. The fact is, in fact, I remember Dr. Makwana, Rahul and all organizing a session in one of the conferences in Jodhpur. The fact was, he was there, Dr. Renu and Rahul and Tarika. Nobody turned up. So I think if the initiative, because we realize it, but I guess those who have gone through it, I would be very happy. In fact, I've done a session during COVID for doctors, MDs. And we have data about burnout, stress, anxiety, proper study. So why not for our own fraternity?
Yes. And Dr. Rajvi, believe me, now this generation is totally different. I used to talk to so many embryologists. ये chance मिलता है बात करने का, और उनसे जब we try to understand, तो मुझे समझ में आता है कि this is really need of the day. And not for only for them, it is for us also. मैं भले ऊपर से कितना भी देखूं, but कहीं back of the mind मेरे दिमाग में चल रहा है कि कल मेरे को उज्जैन मेरे काम पे फिर से जाना है, right? So we also need that stress-free life. So I think this is a good idea. You can think of it and can devote some of your precious time to get us learn about this de-stressing with the help of yoga.
I'll be happy to. I've been teaching for decades now, so yes, I can be very happy to do that.
And I have already proposed this in our ACE upcoming conference to have a session on yoga, particularly yoga for the clinicians or embryologists or whomsoever is present there for 15 minutes or 30 minutes. At least some knowledge they should get. Let's see.
Yes.
So
We
with
can
kind permission,
stop recording now.
yeah, we conclude this. I think, Doctor.
बिल्कुल. Thank you.
Okay, so once again, thank you very much.
Thank you so much.
Really enjoyed.
Thank you, sir.
Enjoyed.
Thank you, वकील. Thank you, वकील. It was wonderful actually. तुम्हारी वजह से हो गया और बहुत ही बढ़िया हुआ. I think
बढ़िया.
बहुत मजा आया. मुझे लगता बहुत लोगों ने सुना होगा.
100% सुना होगा, और नहीं भी सुना होगा तो वर्ड पब्लिसिटी इतनी होगी, माउथ पब्लिसिटी तुम देखना. मैं ही बताऊंगा 10 लोगों को कि तुम
नहीं. मैं एक्चुअली में वही कहने वाला था वकील, मुझे ना जल्दी से इसका वीडियो प्रोवाइड कराओ. मैं इसको है ना
So we are still live, sir.
Yeah, it's on Facebook in any case.
It's on Facebook Live, sir. We are on Facebook Live.
Yes, sir.
So it will be there. Yeah.
आप मुझे दे देना, हमारी वेबसाइट पे भी डाल देंगे, हमारे यूट्यूब चैनल पे डाल देंगे, और फिर हम प्रमोट भी कर देंगे इसको अलग तरीके से ना. We will send in all the groups, we will send it.
Okay. So thank you very much. मैं छुट्टी चाहता हूँ, मुझे परमिशन है तो.
छुट्टी सबको है.
Okay, thank you.
Thank you.
Thank you, sir.
Thank you very much. अच्छा बना दिया तुमने निशाद, स्टोरी तुम दोनों की बढ़िया हो गई, मजेदार
स्टोरीज तो मजा आती है. It's always fun to listen to.
हाँ, अच्छा हो गया, एक्चुअली में अच्छा हो गया. मैं ये सोच रहा था क्वेश्चंस तो बनेंगे नहीं यार, कैसे करेंगे हम एकदम अचानक से ये सब.
सर कहानियों के लिए क्वेश्चंस नहीं लगते, बस